call the hearing to order for Senate Bill. Whoop, let me turn my mic on here. Maybe I'm being picked up by the other mic anyway. Call the hearing to order for Senate Bill 401 relative to Medicaid reimbursement rates for hospital birthing services, and recognize the prime sponsor. Sir.
Good morning, Senator Ray, members of the committee. Jeb Bradley for the record, Senate District 3. Pleased to be here as the sponsor of Senate Bill 401, which is a real simple bill. It would increase the reimbursement rate under Medicaid for birthing services from the Department of Health and Human Services. There's no fiscal note, unfortunately, so it's hard to assess the cost, but the rationale for the bill, I think, is pretty simple, especially in areas of the state that I represent across the North Country, where more and more hospitals are not, for financial reasons, performing obstetric services, and young families having to travel long distances in order to get the kind of birthing services that everybody should have access to. So I know there's going to be testimony from the department. Henry Lipman is here with a potential different approach to this bill that would be a little bit more comprehensive. I think at the end of the day, we're going to need to have a pretty good idea of what the fiscal impact is going to be. But I think it goes without saying, and I'll stop here, that the impact on the more rural areas of the state that have limited birthing services is really an imposition on young families and pregnant women. So I would hope that we can work with the department, pass this bill, get the fiscal impact better established, and hopefully move it forward. Thank you, Mr. Chair.
Thank you. Are there any questions from committee members? Seeing none, the next up would be
too easy.
Mr. Lipman and Ms. Tully. Looks like they would like to come up together.
Furniture.
Good morning. For the record, Henry Lipman, Medicaid Director.
Good morning. For the record, Director of Public Health Services, Patricia Tilley.
Supporting our testimony this morning, handing around a map that has a couple of red circles on it that I think helps to highlight what Senator Bradley was speaking to. This map actually is missing the closure of Parkland Medical Center, which closed fairly recently in the southeastern part of the state. But you can see that if there have been news articles out there that I certainly could provide the committee about risks to maintaining maternity services in Littleton, which is in the upper left-hand side of the map. You can see that you get a pretty big distance of geographic issues for families trying to deliver babies, and across the center of the state, going from east to west, mid part of the state. Spear has been in the news about it, AVH. So, in terms of conversations that we've had, there have been 10 closures since 2000, 3 since 2018, and I think we're at risk for between 3 to 5 additional potential adjustments in what happens. The state only has 5 what you would consider high-volume centers, and Concord, Manchester, Wentworth, Douglas, and the Seacoast, and Dartmouth. So another recent article that looked at what's going on nationally in terms of, they talk about restoration of rural access. We have the opportunity to preserve it. It's a lot easier to preserve something than to restore it once it's gone. It's very hard to reestablish. There was also another piece that came out recently within the past week talking about New Hampshire's most recent level of births per thousand, and New Hampshire was 49th in the country with respect to the number of births per thousand. And basically that's an issue, I think, for us broader than what's even in front of the bill here in terms of, you know, the drain of families and children, which are key building blocks in terms of maintaining rural communities in particular, but also for the whole state in terms of economic development. I wanted to ask Tricia if she would address sort of the concern that the maternity desert has from a public health standpoint.
Sure. Thank you. So as the map shows, we have these significant areas of the state where we simply do not have access to birth facilities. And so what we've seen as an impact from that is a reduction, first of all, in women getting the appropriate prenatal and postnatal care that they need, which obviously puts us at higher risk for poor outcomes both for mom and baby. We've also seen, which is very concerning, an increase in the number of births in unplanned places. So that could be something you could envision as a birth on the side of the road, but even equally as disturbing is a number of births that are in the emergency departments. So, you know, if you think about the entire upper part of the state, anything north of Spear really has very limited access to care. And so as we have a snowstorm coming this weekend, we really have significant issues with the travel distance it takes to get to a birthing facility. So that has other impacts. So it has the impacts of a birth in an emergency department, which is not the best place for that. That's not where the physicians are best prepared. It's certainly not supportive for mom and baby. We also have issues, again, around prenatal and postnatal care, of getting the care that you need. And then we also see the increased number of elective cesarean sections, because once again, you have to plan to have that baby when there is such a large distance. And we know that we've done tremendous work at trying to reduce those elective C-sections where they're not medically indicated because of risks to mom and baby, as well as the cost added to that. So you have all of these factors really creating a public health concern around, and we are concerned that we're going to continue to see poorer outcomes. And as you know, New Hampshire's always done really well in terms of mom and baby outcomes. We've usually had really good attendance at prenatal and postnatal care, and we're seeing that shift. And part of that, I think, we can attribute to these areas of the state where we do not have appropriate access.
Thank you, Tricia. So in terms of picking up on what Senator Bradley spoke about, Medicaid rates are important, but Medicaid, you know, they're about just under 12,000 births the past couple of years in New Hampshire. You know, Medicaid statewide is about 26% of the entire births, but in other parts of the state, particularly the ones where you see the potential deserts, it can be over 50%. And so I think that Medicaid rates are part of the equation, but I also think there are disparities in the non-Medicaid support of our most vulnerable locations, and would like to work with the committee on that part. I think there might be, in terms of the fiscal note, I apologize that it wasn't available for today, but I do, on my way down here, we finished up the fiscal note. But what's in the bill as it's currently out there, it'd be $4.8 million in total funds, 2.4 in general funds, and that covers the DRGs that Medicaid pays for the mom's delivery and the babies. I also think that, you know, the bills that you took up earlier last week in terms of 407, in terms of the postpartum, and 408, which dealt with the birthing centers that are not affiliated with hospitals, these three bills, I think, are important to making things work for families in the state, and we're really appreciative that Senator and the sponsors brought this bill forward, and we appreciate being able to work with you to refine it a little bit, because I think just, not everything's a nail, if you will. And we need a few different things to, I think, make this access to and preservation to happen, because I think if we do nothing, it's going to fall apart, and I think it'll be a lot more expensive to put it back together again. We see that in other parts of work that we do in the state. Thank you.
Questions, Senator Whitley?
Thank you, Mr. Chair, and thank you both for your, demonstrated commitment to maternal health. It's a scary situation, as you identified in New Hampshire. I mean, we are a modern society. We are trying to, get more young folks, and if we can't provide sort of this basic level of care, this is the foundation, right, about how we're going to build our society and our economy. It's particularly, sort of alarming to think about all these births happening in different places. Like, that's just baby safety, right? You're thinking about the safety of mom and baby and thinking that babies are going to be born in cars. I mean, I think this is a real emergency, and I appreciate you identifying that. So I'm wondering if, this bill combined with 407 and 408, is it the thought that possibly we could see reopenings rather than just preventing closures? What more can we do to encourage reopenings?
I think that in regard to specific answers there, I think there are some collaborations that are occurring in the state, but I think one of the things we need to, ask of the delivery system is to try to maybe work together differently. I know that they're discussing and look at things. I think there's a grant in that Dartmouth Hitchcock has that they're pulling together folks to work on, but banking as an example, a lot of it has been able to be digitized. The problem with births is there's a component of physicality to it that can't be, and I think that if you look at the money that I identified that Medicaid here, it's not an insignificant amount, but in terms of looking at what it means to the future of the state and its demographics, I think it's pretty important and well spent. And I also think that, when I talk about, I've had discussions with Taylor Coswell about this issue, and there, at some point, it may be worth to engage him in the committee's work on this, because I think there may be some support that might come there, because I think, in the work he's trying to do to keep the North Country going, that in particular, as an example, that, losing, the birthing option at ABH would be very, basically you kiss the demographics of that area goodbye in terms of being any chance of recruiting for employers. And I think you'd hear him mention that if he was in front of us today.
Follow up?
Yep.
So that's great. I think, your suggestion about potentially working with Gopher on a ARPA request, I think in combination with, 401, 407, and 408. And so I just want to encourage that conversation. I'd be happy to be a part of it. I'm sure Senator Prentice, who brought 407, and Senator Bradley would be willing to be part of that conversation as like a solutions-oriented. What could we use those ARPA sort of temporary funds for to get this really stabilized?
I'm not sure in terms of, it could be ARPA, but I'm not sure that that was the only source that he saw in terms of addressing it. I think in terms of any prepared remarks, I think that covers it. I think, the issue of disparities in that Medicaid alone can't hold up the whole system. I think that's part of the equation as well.
Any other questions? Okay, so my understanding is you're going to go back and then come back to us with a proposal that's going to be broader than just Medicaid.
Yes, as well as potentially suggesting maybe some targeting of the investment being made here to where we have higher risks potentially.
Grant, help me out since you're here. When is the deadline to have FN bills out? Early, the first week in March?
Yeah, I believe it's March 10th.
Okay. So we have a little bit of time.
So It's March 17th is the deadline to get it out of committee.
A little bit of time. Really? Out of committee to be able to go to finance?
March 17th is the deadline for committees to act on all Senate bills with fiscal impact except bills exempted pursuant to Senate Rule 4-5.
Okay. Okay, this, given what I think you're gonna be proposing, broadening it out, may require a second public hearing.
Sure.
So just take that into account. Okay?
Thank you. Thank you.
Okay, great. Paula Minahan, good morning.
Good morning, Mr. Chairman, members of the committee. For the record, Paula Minahan, Senior Vice President, State Government Relations, New Hampshire Hospital Association, representing all our hospitals. We are in strong support of Senate Bill 401, and we do appreciate you, Senator Bradley, for sponsoring this bill, as well as all the co-sponsors and strong bipartisan support. There are currently 16 out of our 26 acute care hospitals that provide obstetrical care, and only 5 of our critical access hospitals, as Mr. Lippman said, continue to have labor and delivery units. Androscoggin Valley Hospital in Berlin, Littleton Regional in Littleton, Memorial in North Conway, Spear in Plymouth, and Monadnock in Peterborough. A total of 10 hospitals do not offer obstetrical care, 8 critical access hospitals, and 2 of our larger hospitals, Parkland in Derry and Concord Hospital, Laconia. Hospitals have had to close their OB units for several reasons, most notably due to low number of births. A hospital needs to have more than one obstetrician on staff in order to provide sufficient obstetrical coverage 24/7. Low reimbursement rates are another contributing factor as to why a hospital must make a hard choice to close this service. Senate Bill 401 is an attempt to at least address the Medicaid reimbursement rates for labor and delivery services. While the cost to provide obstetrical services are greater than the proposed Medicaid reimbursement contemplated in this bill, our hospitals that continue to offer these vital services are very appreciative of the proposed increase into the Medicaid rate for labor and delivery care. I'd also like to mention, and I handed out 2 of our critical access hospitals, Littleton Regional and Spear, submitted written testimony. I think Littleton submitted it via email, and Spear, their CFO, asked me to hand it in this morning, so you should have that, Travis Boucher. And I again am happy to support this bill and appreciate your support, and happy to answer any questions you may have.
So we do have a letter from Littleton from Mr. Nutter.
Yep.
And obviously you'll get the letter from
Oh.
Spear.
I just handed it to your clerk, so it'll be distributed. Yeah.
Perfect.
Yeah.
Other questions of Paula? Okay.
Thank you.
Both Littleton and Spear obviously signed in support of the bill. I think that's it in terms of public testimony, but stay tuned, and thank you back very much. All right. Seeing nothing else on this, we're not even ready to think about execing. We'll close the hearing. You ready to go? We'll open the hearing on Senate Bill 403.
Thank you, Mr. Chair, and good morning, members of the committee. For the record, my name is Becky Whitley, and I'm honored to serve New Hampshire Senate District 15, which includes the wonderful communities of Concord, Pennacook, Henniker, Hopkinton, and Warner. So I'm honored today to bring forth Senate Bill 403, reestablishing the Farmers Market program in the Wic Program. For a quick refresher, the Wic Program provides supplemental foods, healthcare referrals, and nutrition education, including breastfeeding promotion and support at no cost to low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to 5 years of age who are found to be at nutritional risk. So the Farmers Market program is designed to provide both a supplemental source of fresh produce, fresh fruits and vegetables for WIC recipients, and to stimulate an increased demand for New Hampshire grown fresh produce at New Hampshire farmers markets. I will say in my communities, we have a robust farmers market in all of my communities, and farms, local farms, family-owned farms that are really part of the fabric of my district, and I know of so many other people's districts. We love our local farms in New Hampshire. Reestablishing the Wic Farmers Market program builds on the support of the SNAP Health Incentive Program that this body passed unanimously last session. It was included in the last year's budget. New Hampshire stopped offering the Farmers Market program in the Wic program about 10 years ago, and I think it's just past time to bring it back. So last year, the legislature really saw the value of this and saw that it was a triple win for New Hampshire. It boosts our local economies, it provides these wonderful health benefits to our recipients, and economic opportunities for our local farmers to sell their produce. So SNAP farmers market incentives are already very active at dozens of farmers markets and grocery stores. You may remember that conversation last session. Just like the SNAP program, food benefits in WIC are matched 100% by federal dollars. Modest state investment will allow the state to draw down additional federal dollars to broaden access to fresh fruits and vegetables for program recipients and to administer the program. The state match is for the administrative side, of which we will also receive some federal funds. So again, federal funds support 100% of the food costs and 70% of the administrative costs of the farmers market program. So just in short, this bill supports the fact that everyone should be able to access fresh fruits and vegetables, and will support what we know is a disparity in who can access fresh fruits and vegetables from our incredible local farms and vendors. So thank you for your consideration of the bill, and I'm happy to take any questions, although we do have many experts behind me, in particular Lisa Soroy, who administers the WIC program. She can answer all your technical questions about it. Thank you.
Seeing no questions, thank you very much. Okay. So we will go right to Ms. Savoy. Did I get that right? Close enough? Sorry about that.
Good morning, Mr. Chairman and members of the committee. My name is Lisa Soroyce. I am the administrator over at the Nutrition Services section in the Division of Public Health Services. And so within my section, I oversee the WIC program, so I'm also the state WIC director. So I'm here today to speak in support of reestablishing the WIC Farmers Market Nutrition Program. This bill would allow us to provide access to low-income children to be able to redeem coupons at local farmers markets for fresh, local, unprepared fruits and vegetables. And so as Senator Whitley shared, our program has not been operable since 2010. And so a little bit of background, the reason at that time leadership had made the decision to stop operating the program was we were seeing low redemption rates amongst children at the farmers. And the administrative burden was becoming hard to keep it up. And so we feel like now, 10, 11 years later, our farmers market infrastructure is much more robust. There are more markets in our community, and based on participation of markets in the SNAP program, we feel like there is interest for farmers and farmers markets to come back to the WIC Farmers Market program. And we feel like the infrastructure now is stronger that we would be able to administer this better. And so Senator Whitley did share a little bit about the WIC program, of which I oversee. We serve about 10,000 low-income families, which make up those 9,000 children between the ages of 1 and 4 that would benefit from this program. In addition to education and nutritious foods that we provide, we also provide referrals to healthcare and social services. And so providing this would give them access to fresh local fruits and vegetables above the nutritious foods that they already receive on the WIC program. And just so you know, in order to be eligible for the WIC program, their income has to be at or below 185% federal poverty. So we're talking middle to lower income families. So reestablishing the program would be supported by some federal dollars, of which we have submitted a state plan to the United States Department of Agriculture, which funds the program. We're pending approval for that, as well as an award. And the appropriation in this bill would allow a $10 benefit that the federal award would support to be increased to a $30 benefit for children to redeem at farmers markets. And we feel like $30 is much more attractive for a family to make a trip to a market, and that they'd get a little bit more fresh produce as opposed to a $10 benefit, which may have contributed to the lower redemptions back in 2010. In addition to the obvious benefits of fruits and vegetables, our low-income children are starting to see a trend of obesity amongst them. And so one action that we would like to take to try to combat that and prevent a further increase is just giving more access to fruits and vegetables and increasing utilization of fresh fruits and vegetables so that we can be a part of slowing that trend that we see. And then in addition to just the benefits of fruits and vegetables, we feel like this bill will really support New Hampshire's local agriculture industry. And the majority of these funds go back to our New Hampshire farmers. So thank you for your time, and I will be here if there's any additional questions. Thank you.
So, Mr. Roy, I'm sorry again. I read a V, not an R. That's how I got that wrong. Just looking at the fiscal note, it appropriates $300,000 in the next upcoming fiscal year. I'm assuming that this is an ongoing initiative.
Yes.
So I'm assuming the reason that 24, 25 are zero is because it would be considered in the next budget. Is that
Yes.
correct? Okay. All right. Further questions? Seeing none. Thank you very
Thank you.
much. Let's see, Representative Wallner supports not wishing to testify. Brendan, oh boy. There you go. Thank you very much. New Hampshire Food Bank.
All right, great. I'll try to make this brief because I find this terrifying. I'm Brendan Cornwell. I am with the New Hampshire Food Bank. I am the New Hampshire Nutrition Network Incentive Coordinator. In 2010, the Wic Farmers Market program was the only federal nutrition program being offered at New Hampshire farmers markets. Since then, farmers markets have changed. Many markets have embraced new technologies, which have enabled New Hampshire farmers markets to expand to include many more nutrition programs. Incentive programs such as Grant State Market Match and Double Up Food Bucks offer a dollar-for-dollar match on fresh fruits and veggies. These are successful programs that connect New Hampshire farmers with federal nutrition funds. In 2021, these programs redeemed almost $670,000 in federal dollars for New Hampshire grown fruits and vegetables. These programs have similar requirements to the Wic Farmers Market program, so New Hampshire farmers and farmers markets are familiar with the requirements a program like this entails, like vendor training, guidelines, and technology. The Wic Farmers Market program helps New Hampshire nutritionally at-risk children in the form of fresh fruits and vegetables from New Hampshire farmers. These connections strengthen the health and economy of New Hampshire. Support of this bill will give food insecure children of New Hampshire access to nutritious New Hampshire grown apples instead of imported apples harvested months ago. It will give New Hampshire toddlers access to blueberries grown by New Hampshire farmers. And I would really like the kale that a New Hampshire child pushes away from the dinner table to be kale from New Hampshire.
Great.
That's it.
Any questions of Mr. Cornwell?
Thank you.
Seeing none. Your colleague from New Hampshire Food Bank, Eileen Laponis, who signed in support, doesn't wish to speak. Same with Nancy Vaughn of the American Heart Association. Tiffany from New Hampshire Hunger Solutions. Good morning.
Good morning, Chair and members of the committee. My name is Tiffany Dodier, and I am the Community Engagement Director speaking on behalf of New Hampshire Hunger Solutions, which is a nonprofit that seeks to end hunger in New Hampshire. Part of my role is to coordinate the New Hampshire Food Access Coalition, which is a statewide group composed of nonprofits, research institutions, medical organizations, state agencies, and businesses across New Hampshire's food system. Since the outset of the pandemic, this group has advocated for policies that improve access to nutritious food for all New Hampshire's people, including last session's SB 98 for nutrition SNAP incentives. Today, we submit this testimony on behalf of our partners to state our strong support of Senate Bill 403 to reestablish the Wic Farmers Market Nutrition Program. This bill supports an evidence-based strategy to connect more women and young children to fresh, locally grown produce while supporting our farmers and bolstering local economies. A large part of my day-to-day work includes collaborating with organizations across the state to address hunger in New Hampshire. The COVID-19 pandemic has necessitated this work more than ever, and it is because of the increased connectedness of New Hampshire's organizations working to end hunger that we know that this is the right time to reestablish the Wic Farmers Market program. We now have the infrastructure in the state to support the administration, thanks to programs like the Granite State Market Match, which you heard testimony about today, and as a possible viable model for the Wic Farmers Market Nutrition Program. We have a growing list of over 200 partners in all corners of the state, where we endeavor to support the development of local food access coalitions, and these coalitions make possible widespread campaigns to promote the use of the Wic Farmers Market program and education about the importance of eating fresh and eating local to our individual health and the health of our local economies. This bill is important now because increasing numbers of our neighbors report having trouble securing adequate nutrition, nearly 85,000 New Hampshire adults as of January. As most of you have heard and seen about the increasing food costs, the U.S. Department of Labor just reported an over 6% rise in food costs in the last 12 months. This calls for measures that keep fresh produce affordable to our most vulnerable people. This bill does that while also helping New Hampshire farmers. As a registered dietitian, I know the importance of fresh produce intake to young children and pregnant women for optimal growth and development. We also know earlier exposure to fresh fruits and vegetables leads to greater consumption as older children, thus continuing to overall health in our children and less strain on our healthcare system. We have the infrastructure to support the administration of Wic Farmers Market Nutrition Program and should take advantage of that. A final point to remember is what is known as the multiplier effect. Every federal dollar spent on food purchases through programs like WIC and SNAP, for example, has shown to generate at least $1.50 in local economic activity. New Hampshire residents purchase food from farmers who use that money to support their business by purchasing supplies from others, and so on. This bill represents a thoughtful, conservative, and innovative investment in the health of our mothers and children and local farms and farmers as well. So I urge the committee to recommend SB 403 ought to pass.
Great. Thank you very much. Other questions? Seeing none. Thank you. Ms. Dodier's colleague, Laura Milkner, I think, has signed in support, not wishing to speak. And our last person wishing to speak is Rebecca from New Futures.
Good morning, members of the committee. I'm going to be very short and sweet. My name is Rebecca Vlakovsky, and I'm the Kids Count Policy Director at New Futures. New Futures is a nonprofit, nonpartisan advocacy organization that advocates, educates, and collaborates to improve the health and wellness of New Hampshire's residents. And my work really focuses on our children. So we support Senate Bill 403 because we know how important access to food is to the mitigation of ACEs. So not only you've heard great testimony about how this is beneficial to the health and wellness, I just urge the committee to consider that families where caregivers can meet basic needs of food, shelter, and health services for children is a protective factor against the impacts of ACEs. So we urge the committee to vote Senate Bill 403 ought to pass.
Seeing no questions, thank you very much. So I'm going to close the hearing on SB 403, the time being suitable. I'd entertain a motion. Senator Gray moves exec, Senator Sherman seconds. All in favor say aye.
Aye.
I'd entertain a motion. Senator Gray's beat me to the punch. Ought to pass. Seconded by Senator Sherman. Boy, you're even in more of a hurry than me.
I just have one
Ken?
question, Mr. Chair.
Yes.
It's a one-time appropriation. Is that enough?
No, it has to be folded into the next budget, so it recreates the program, it would be considered in the normal budget process next year.
I was just thinking $30. It's nothing really. Okay.
Okay?
Can you just say the bill number? You haven't said it yet.
Yeah, we're execing on Senate Bill 403. The motion is ought to pass. All in favor, say aye.
Aye.
Any opposed, say no.
Second?
All right, it's been moved consent, seconded. All in favor, say aye.
Aye.
I'll take this one out because the blurbs have to get written today. Okay? And
Motion to move out of exec?
Yep, thank you. All in favor of moving out of exec? Okay, so we'll now open the hearing on Senate Bill 404. Good.
Okay, thank you, Mr. Chair, and good morning again, members of the committee. Thank you again for acting so fast on the previous bill. I think it's a great opportunity, again, to prioritize food insecurity and move forward. So today, again, for the record, my name is Becky Whitley. I'm honored to serve New Hampshire Senate District 15. Today, I'm honored to bring forth Senate Bill 404, establishing an outreach program in the SNAP program. So this committee may know that food insecurity remains an issue in New Hampshire and has only worsened during the pandemic. We know that our low-wage earners have been particularly impacted by food insecurity due to stagnant income growth in our state and, of course, our high cost of living. But thankfully, the federal government provides support to address food insecurity through the Supplemental Nutrition Assistance Program, otherwise known as SNAP. And a quick refresher on SNAP, this program provides essential nutritional aid to individuals and families throughout New Hampshire and, of course, around the country. These benefits are federally funded and dispersed to eligible New Hampshire residents who may be experiencing food insecurity. So I want to point out that despite an ongoing need for nutritional assistance, a report from the New Hampshire Fiscal Policy Institute, a July 15th, 2021 report, showed that there are more eligible individuals in New Hampshire than are actually enrolled in SNAP. So that means we have a large group of people who are eligible for these 100% federal funded benefits that are not enrolled. And the question is why? So estimate shows there are up to 17,000 additional children. That number takes my breath away considering our total population of children in New Hampshire. 17 additional children eligible for aid who are not receiving that in 2019, as well as tens of thousands of adults who are likely eligible but not enrolled in SNAP. The Fiscal Policy Institute analysis detailed that if those 17,000 children in the state had been enrolled in SNAP in 2019, and each child was in a separate household that received the average benefit amount during that year, then additional $37.9 million in federally funded aid would have flowed to New Hampshire to support Grant State families and, of course, the economy during that year. The estimated under-enrollment may have resulted in the loss of accompanying economic stimulus to our local economies and grocers. In that same analysis, the Fiscal Policy Institute detailed that levels of under-enrollment in nutritional aid and SNAP may have continued throughout the duration of the pandemic. And that's because data from the U.S. Census Bureau showed that significant portions of New Hampshire's population face declining or lost incomes and challenges affording expenses and food, even while enrollment in SNAP declined during the crisis. To me, this is a problem crying out for a policy solution. Luckily, the federal government gives states flexibility to expand eligibility for SNAP and to conduct program outreach, which helps ensure that information about benefits and eligibility is available to residents who may qualify. The federal government reimburses states for half of the cost associated with outreach programs, so long as those costs are part of an outreach plan that's approved by the federal government. It's the Department of Agriculture. Outreach plans are strongly encouraged by the federal government because they help improve program participation and, of course, ensure more stable access to food to people who truly need it. Unfortunately, New Hampshire has not had an outreach plan for 5 years. The last approved outreach plan ended in September 2017. Outreach to eligible granted staters can also help those disproportionately impacted by the crisis and folks who may have become eligible for SNAP for the very first time due to the crisis. So the bill before you is a very well thought out proposal with bipartisan and bicameral support. You'll see that there is bipartisan support in both the Senate and the House. So I will note that there are 2 amendments on the table for this bill. In discussions with Department of Health and Human Services. So I will say that the initial proposal in the bill was a revenue neutral one. We know there are community partners that are willing to shoulder the state costs for the state match for the admin side. And so the original draft was budget revenue neutral. It didn't require state funds, okay? But DHHS has requested a couple things. The first amendment, which is 0252, simply just sort of clarifies the deadline. So I think that's a simple housekeeping order amendment. The second amendment, 0296, is something I think the committee will want to discuss. So this was requested by the department. So instead of, they were concerned that the way that the language read, it would prohibit the use of state funds for an outreach plan, and they didn't want that going forward. So you'll see that the amendment says the department shall give preference to private or federal dollars sufficient to cover the state's cost with implementation. So it gives a preference for private or federal dollars. It doesn't prohibit the use of state dollars. But again, I still think that this could be accomplished in a budget neutral way. So happy to take any questions. Again, we have lots of experts behind that can discuss this.
I think you're off the hook for now.
Great.
Seeing no questions. All right. So why don't we go right to the department, Ms. Herbert? Good morning.
Good morning. For the record, my name is Karen Hebert, Division Director for the Division of Economic and Housing Stability for the Department of Health and Human Services. So the department really agrees that an outreach plan is extremely important, especially in light of rising food costs for families. And based on the research, as I understand, from Senator Whitley, who has done an excellent job in researching the issue, that apparently there are certainly individuals who could be eligible for food stamp or SNAP benefits that have simply not applied. The department has not been able to do an outreach plan since 2017, in part because of certainly the pandemic. But because we agree that the outreach plan, having a plan, is extremely important to the state and to families in the state, the department already initiated an outreach plan, which does not require legislation. So we are standing that up. We are developing at the moment a request for proposals for a grant application for individuals to apply for that particular benefit, where the federal government will match 50% of the administrative costs for individuals who want to conduct an outreach plan. So we've initiated this, and we expect to have it completed by the federal government's deadline, which is August 15th of 2022.
Senator Whitley.
Thank you, Mr. Chair, and thank you, Karen, for your testimony, and of course, thank you for the department's commitment to work on this. You know, I think that we had a discussion that how important it is to have a belts and suspenders approach to something that is so important for basic food insecurity. And so, you know, absolutely, I'm happy that the DHHS is working on this plan. I think support from the legislature for that work is integral. I'm wondering if you agree with that.
I don't necessarily agree. I think that for the department, it's just simply not necessary. It's not required. I applaud certainly the efforts of the legislature to move forward with supporting the department in conducting this kind of initiative, but it simply isn't required. And one other point on the bill I did want to mention that I think we're trying to work towards addressing is the inability for the department to make use of general funds for the administrative or implementation of the plan. And that is very challenging for the department as we are using existing resources currently for this year's initiative, which, you know, the support structure for the department certainly relies on general funds to be able to do that.
Sorry, Ms. Hebert, had you seen that amendment I sent out? It may have been yesterday or this morning. It addresses that concern about state funds.
I haven't had a chance to really take a good look at it, but
Cameron, do we have an extra copy? Great. If you don't mind taking a look at it, I would like to see if that addresses your concerns about prohibiting state funds.
One of my concerns is that we've had this gap since 2017 where the department chose not to do this. Putting this in legislation and in statute, would you agree that it will take away the option if you all decide not to do this? The legislature is saying, no, this is a priority. This is critical, not only for our economy, but for our children. So we want this done. It takes away the option of the department maybe getting a little overwhelmed and just falling down the priority list like it did in 2017, because it's now 5 years later and it hasn't been done. So is that not a good reason for the legislature to move forward to make sure that you understand the options, the priorities of the legislature, which include the economy and nutrition for the children?
so I believe that there are a number of competing priorities, of course, within the department, where capacity is certainly a concern constantly. So I think that in light of, and I'd have to look and see prior to 2017 when the last time the department did an outreach plan. I don't know that, so I'm not sure if that particular gap may be relevant, but I think that the department, because it agrees already that this is an important initiative to be taking on, which is why we did. We started it prior to Senator Whitley introducing the bill. So it is a priority for the department. We intend to complete this and can continue to look at the priority of an outreach plan. This is incredibly important for families. So we do support it and do see it as a priority, and we do the best that we can.
So if the committee chooses to move forward with this and it moves through the process with the two amendments, in particular the one I think that you referenced, which would allow use of general funds, if we move forward with that, is there any hindrance that causes from the efforts that you're already undertaking?
And I believe
I tell
that
you what, we'll get you back up here. Why don't you have a chance to think about it, if that's okay, unless there are other questions? Oh, okay. John just said she has to go to.
But we certainly will work with the committee on wordsmithing some language. I would state, just on a first read of this, what you said specifically, Senator Bradley, about that nothing in this shall prevent or preclude the department, or actually say it in the positive.
Hinder your
efforts around the general fund. It doesn't actually say, it says the department will provide preference, but it doesn't give us the direct authority that we currently have to use general funds. I would say the language needs to be shored up a bit to be very, very clear that we could utilize general funds. Thank you.
Question?
Okay.
Jen, if you read the bill, in reading the bill, I see nothing prohibiting the use of state funds, and I think the amendment makes that clarification. It's clear as day.
And the day can always respectfully be clearer, and if you could include what was suggested, it would be very helpful. Thank you.
Yeah. So I
All right.
No. But I think it's important because I had asked for the department for sort of clarifying language, and that's what this amendment is. Yeah.
Okay. All right. You can go to governor and council. You got 6 minutes to get there.
Thank you, sir.
All right. Thank you, Ms. Hebert. Okay. Got a lot of people wishing to speak, so we'll start right at the top. Ms. Laponis.
Mr. Chair,
Yeah.
if the testifiers would leave the mic on, then there'll be less people touching it and all that good stuff, and people will probably be happier if they just leave it on.
Okey doke. I'm sure everybody will do that.
Thank you. Thank you, members of the committee. It's an honor to be able to present to you. My name is Eileen Laponis. I'm the Executive Director of the New Hampshire Food Bank. We stand in support of SB 404. I believe the legislative intent of this is to never be in the position of having 5 years without a state outreach plan again. Passage of SB 404 would state that New Hampshire is committed to doing everything within its power to fight food insecurity in the state. This legislation intends to ensure that New Hampshire will always have a state outreach plan program for SNAP to maximize the ability of New Hampshire residents to become food secure. What is food insecurity? Difficulty in accessing and affording food is formally described as food insecurity. It's defined when households are, at times, unable to acquire adequate food for one or more household members because they had insufficient money and other resources for food, according to the United States Department of Agriculture. So what are those other resources? The Supplemental Nutrition Assistance Program is considered the first line of defense in fighting hunger in America. SNAP purchases are restricted to food purchases only, and New Hampshire has close to the lowest rate of fraud in the country, but Don McKinney of New Hampshire Legal Assistance will go into detail on that for you. The second line of defense is the charitable food system. That's where we come in. The New Hampshire Food Bank is the state's only food bank that supports over 400 of our partner agencies. Those partner agencies are the programs in your community that feed our food insecure, our food pantries, soup kitchens, homeless shelters, after-school, elderly, and other feeding programs. New Hampshire currently does not have an approved outreach plan. The last approved plan, which you heard about in 17, ended in September of 17. The New Hampshire Food Bank held that contract when it ended, and while we waited for another request for proposals, we sourced other funding and continued our outreach, albeit less effectively than when under contract with the state. When we are under contract with the state, we are able to measure our efforts. We are able to have the success rates of the people that apply for SNAP. Without those measures of success to raise matching funds needed, it's very difficult. To date, we've had a donor that supports our work without the data. Without the faith of that champion of our work, it is very difficult to raise money without measures of success. The effect of not having a state outreach plan for close to 5 years has been thoroughly analyzed by the New Hampshire Fiscal Policy Institute study, which I cite, and I selected the most telling table from their study to show how poorly we are doing compared to our sister states who do have that outreach program. Now, during that 5-year period that the state went without the outreach program, the pounds distributed by the New Hampshire Food Bank to our partner agencies increased by 27%. I'm not drawing a direct correlation, but during the past almost 2 years, when our agencies have been strained with meeting the increased demand from COVID, while at the same time losing their volunteers, their pounds have never gone down. What has gone up is the mobile food pantries we've had. In order to ease some of the strain, to have those citizens be able to purchase the groceries they need to feed their families is very important, and you will hear that from the leader of the New Hampshire Grocers Association. Our grocery partners would appreciate the economic activity as well. We were able to make progress during the pandemic through outreach at our mobile food pantries. I included the testimony of my colleague who was unable to attend and a sample of the outreach material that we have. To give you an idea of the increase we've experienced over COVID, in 2020, we had 70 mobile food pantries serving over 29,000 families with 1.9 million pounds of food. In 2021, We held 122 mobile food pantries serving 42,000 families over 2.6 million pounds of food. I point out these numbers because many of the folks affected by COVID haven't needed social services before, and our mobile food pantries are an easy entry point. SNAP is an efficient tool to solve short-term needs for food assistance for the families who need it. The cost of the mobile food pantries for the New Hampshire Food Bank is unsustainable, and folks need to take advantage of this federal support during their time of need. We look for your support of SB 404 so we can show our New Hampshire citizens that suffer from food insecurity that together as a state, with the support of the nonprofit community, that we help our vulnerable food insecure to not only survive but thrive with the ability to purchase the food they need for their family during difficult times in their lives. Thank you for your time and consideration. I'll accept any questions.
Thank you so much, and thank you for all your work, the incredible work of the food bank to just literally, provide life-sustaining sustenance to Granite Staters. Like, we are in debt to you and, the people that you have supported. So thank you. I need to start there.
We are in debt to the folks who have supported us financially during this, because otherwise we never would have been able to do it.
Thank you. So what I have heard from a lot of constituents that, know that they could be eligible, that they have a lot of difficulty actually applying for SNAP. It's confusing, sometimes the department is unresponsive. Do you have thoughts about how an outreach program or one the food bank might design would improve that issue?
Sure. We have a wonderful person. We have one SNAP outreach coordinator. She's kind. She's very good on the phone with folks. She's very patient. I have a donor that if we were to get the contract that would want to supply us with an 800 number. I think that's a hindrance to folks that have to call, Manchester. If you're already food insecure, another long distance phone call is not going to help. Our over 400 agencies are in a great position to reach that population and educate them. We would expand our SNAP outreach coordinator position, and we would be able to continue the work that we're already doing, but just have the measures of success and be able to know whether or not the folks that we helped were actually eligible to sign up. Only if they call us back, and they can choose to do that, and they often do. They're so appreciative of the help. We would also look to bring on some language experts. We have one person that speaks Spanish that does take calls when they come in, but we most likely would have to take on some other folks. And I think I probably would partner with AMSCAG because they have 11 different interpreters. So there's many community partners that are ready to come together to put together a robust program. We want to make it the lightest lift we can for the department, and we basically have the plan already written.
Great, thank you. I would encourage all committee members to go take a tour with Eileen of the facilities. It's very impressive.
You're more than welcome.
Eileen, I just have one question. If you look on line 4, the whole purpose of this outreach effort is to promote access to eligible persons. So I think we would all agree that people that are in need, that are hunger challenged, should have access to this. But would you also agree with me that by providing this kind of information about eligibility to individuals, that we also reduce fraud and abuse of the SNAP program?
Oh, absolutely.
Wouldn't that be a primary outcome of what you're trying to accomplish here?
Absolutely. As Dawn will tell you, we don't really suffer from a lot of fraud in New Hampshire on our SNAP program to begin with, so I wouldn't anticipate much more. But definitely laying out the benefits and the eligibility requirements up front is a deterrent for sure.
I asked you the question because Dawn didn't sign up to testify.
Oh.
Okay, got it. Okay. Seeing no more questions, you are good to go.
We all set?
All right. Let's see. Laura Milliken again?
Not again. First time.
Oh, no. I've seen New Hampshire Hunger Solutions. I'm sorry. How are you this morning?
Well, thanks. Thank you. Thanks so much. Good morning, Chairman Bradley and honorable members of the committee. My name is Laura Milliken, and I'm the Executive Director of New Hampshire Hunger Solutions, a nonprofit that advocates to end hunger in New Hampshire. The cornerstone of our federal food assistance safety net is the Supplemental Nutrition Assistance Program, or SNAP.
also known as food stamps. And it's really our first line of defense against hunger. Ongoing statewide SNAP outreach is critical for two reasons. First, because eligibility for the program is determined by states, New Hampshire should ensure that our residents who are eligible for SNAP know it, know how to apply, and can benefit from it. Second, there can be rule changes at the federal level, such as the emergency benefit enhancements during the pandemic, that need to be communicated. Ongoing outreach improves our state's ability to educate residents about eligibility rules, ensuring the program's integrity, and reducing the chance for fraud. It's important to note that hunger has risen in New Hampshire since 2017, the last time that we had a SNAP outreach program. We know that New Hampshire is now 39th in the nation in SNAP participation. The majority, or 60% of eligible older adults in New Hampshire, are not enrolled in SNAP. Estimates are that as many as a third of eligible children may not be enrolled. In the week ending January 10th, 2022, 84,743 New Hampshire households said they didn't have enough food, an increase of 30,000 households since September. 26% of New Hampshire households reported that it was somewhat or very difficult to pay for the usual household expenses. That's 262,000 people in New Hampshire. And those are numbers from the Census Pulse Survey. The rising inflation that we've all experienced is also affecting food prices, which have increased 6% over the past 12 months. We're simply not reaching all those who could benefit from SNAP, and it's clear that the need is great. Statewide outreach will help solve the problem of zip code being a determinative factor in how readily you can get connected to these important resources, because outreach activities can be targeted to the places where people are not enrolled. We want public resources to flow equitably, and we know what works. Studies show that data-driven outreach and application assistance increases participation more than 7-fold in adults over 65. So this legislation requires the state that the state's responsibility is limited to developing a plan and not, it doesn't include implementation unless DHHS receives private or federal money sufficient to recover the cost. The food bank has told us they could raise the dollars. The bill is modeled after a Nebraska law where the Nebraska Food Bank for the Heartland raises the money for outreach and administers the outreach program. The state's only obligation is to submit the plan. It's entirely revenue neutral as written without the amendment. That said, I don't think the original bill precludes the state from seeking appropriations to support outreach in the future. And certainly the amendment addresses that directly. SNAP not only keeps our neighbors from hunger, but communities gain from the multiplier effect of SNAP dollars being spent in the local community. For every SNAP dollar that comes into the state, it's estimated to stimulate at least $1.50 in local economic activity. And as Senator Whitley told you before, in the recent research report of the New Hampshire Fiscal Policy Institute, which estimated that 17,000 children were eligible, may have been eligible for SNAP benefits in 2019, but were not enrolled. And had they been, that would have brought in an additional $38 million in economic stimulus to New Hampshire in a single year. Our system of food and nutrition supports is like a power grid that moves nutritious food to communities throughout the state. But that grid is now patchy in some communities and non-existent in others. This bill will help us plug more communities into the grid, ensuring more children, older adults, and other eligible granted staters benefit from the nutrition support they deserve. Thank you so much.
Thank you, ma'am. Seeing no questions, thank you.
Thank you.
Rebecca again from New Futures.
Promise to be short and sweet again. For the record, my name is Rebecca Vlakovsky. I'm the Kids Count Policy Director at New Futures. New Futures stands in strong support of Senate Bill 404, and I just want to offer one data point. You heard today that the last year that the state had a outreach plan was 2017. Kids Count tracks data of families with children that are enrolled in SNAP. You can see from the resource that I provided in my written testimony that there's been a steady decrease in the number of families with children enrolled in SNAP since the time of our last outreach plan. So there is data to back up that while that is not a direct correlation, you could say that the lack of an outreach plan has really led to less and less families being eligible families being enrolled in SNAP. So for these reasons, New Futures urges the committee to vote this bill ought to pass. Happy to answer any questions.
Very good.
Thanks.
Thank you. Let's see, Michael Polizzotti. Good morning. You didn't indicate whether you support or oppose, but go right ahead.
Good morning, Chairman Bradley and members of the committee. Thank you for the opportunity to speak today. My name is Michael Polizzotti, and I'm a policy analyst with the New Hampshire Fiscal Policy Institute. NHFPI is a nonprofit, nonpartisan, independent policy research organization located here in Concord. We examine the state budget, the state economy, and the economic security of individuals and families in the Granite State with a focus on those with lower and more moderate incomes. So I'd like to share the results of the research that NHFPI conducted surrounding outreach for the Supplemental Nutrition Assistance Program here in New Hampshire. I've provided you all a copy of our October 2021 issue brief, which includes some additional details and methodological discussions as well. The Supplemental Nutrition Assistance Program, also known as SNAP, is officially known as the New Hampshire Food Stamp Program here in the state, and it provided food assistance to more than 68,000 individuals in New Hampshire at the end of 2021, and of this number, about 26,000 were children. SNAP provides nutrition assistance to those with lower incomes and few resources, and the benefits are entirely federally funded. These benefits provide significant economic stimulus in addition to helping individuals and families afford food. Working to ensure that eligible Granite Staters are enrolled in SNAP is key to drawing down these federal dollars to aid adults and children facing food insecurity and for stimulating local economies, particularly when the economy is weak. Moody's Analytics estimated that each additional dollar of SNAP benefits paid in the first quarter of 2021 generated about a $1.61 increase in economic activity at the end of the year, so at the end of 2021. And other researchers have estimated similar multiplier effects as well. Program outreach can play a significant role in providing information about SNAP, so including eligibility requirements, informational resources, and directions on how to apply for the program. This sort of outreach may result in greater uptake of the program among eligible populations in New Hampshire, and NHFPI analysis found that up to 17,000 children in the state and thousands more adults may have been eligible for SNAP, but were not enrolled in the program immediately prior to the pandemic. With an outreach plan approved by the United States Department of Agriculture, half of the costs associated with SNAP outreach will be covered by federal dollars, and the remaining half can be funded through other sources such as the state or donations raised by nonprofit organizations. NHFPI's analysis discussed two factors potentially impacting SNAP's reach. Notably, New Hampshire has not implemented a SNAP outreach plan since 2017. And also, relative to bordering states, New Hampshire places an additional eligibility requirement on certain groups, which excludes many households with lower incomes who do not have children from being eligible for the program. NHFPI analysis concluded that the combination of these two factors in New Hampshire were correlated with lower rates of likely eligible residents being enrolled in SNAP in 2019 compared to other states. The data show that Maine, Massachusetts, and Vermont enrolled a larger percentage of their low-income residents in SNAP during 2019, and these states all had federally approved outreach plans more recently and more consistently than New Hampshire. As the state continues to recover from some of the lingering economic impacts of the COVID-19 crisis and pandemic, greater program outreach and participation in SNAP may aid groups that were disproportionately impacted by the pandemic and provide key economic stimulus for a more equitable recovery across the state. And with that, thank you all for your time and attention. I'd be happy to answer any questions.
Seeing no questions. Senator Sherman.
Just a quick one.
Yep.
You've talked about the return on investment for the federal dollars coming in. Is there any data that you have or nationally on the cost of not providing services? In other words, utilization of healthcare, missed school, all these other things that go along with inadequate nutrition, especially for children.
Sure. I don't have that data or those numbers, but I could provide that with you in an email. So, yeah.
You're right. Thank you very much.
Great. Thank you.
All right, John Dumas, New Hampshire Grocers Association.
Morning, Mr. Chair and members of the committee. For the record, my name is John Dumas. I'm the President and CEO of the New Hampshire Grocers Association. If you're not familiar with our organization, let me explain that we represent the retail food stores in the state of New Hampshire. These range from small independent mom and pop markets and convenience stores to the largest chain operated supermarkets. Annually, the food industry in New Hampshire sells over $2 billion in consumable food and beverage products to consumers through approximately 1,500 stores. I'm sure there's no doubt in anyone's mind that I appear here today in support of Senate Bill 404. Grocers have been pivotal partners in the national nutrition programs, both as providers of nutritious foods and beneficiaries of spending through the SNAP producers. In New Hampshire, SNAP is responsible for 10,361 direct jobs and more than 12.1 million in grocery industry related wages. New Hampshire Grocers Association has been a long-term partnership with the National Grocers Association, the Food Marketing Institute, and the National Association of Convenience Stores. They have always helped support the SNAP program at the federal level, while NHGA has concentrated on assisting in our state. The chart that I've submitted in my contact information comes from the National Grocers Association, and it says it all. While SNAP purchases are not subject to sales tax, sales help generate additional tax activity at the federal, state, and local levels. SNAP sales and administration at grocery store level are responsible for $739,800 in state and local tax revenues and $1.8 million in federal tax receipts. SNAP drove total output of $25.5 million across the grocery and supporting industries. Grocers are key participants in the SNAP's casual chain of reducing hunger and spurring economic benefits to the state. SNAP dollars allow us to hire, purchase locally, and provide nutritious food to our neighbors. Ensuring many eligible people know about the program and enroll allows the grocers to feed, hire, and purchase, and we support this legislation that will provide a much-needed strategy of infrastructure for outreach. Overall points, states need state-specific outreach because they determine eligibility. We have the responsibility to communicate those decisions, details, and eligibility framework to the public. As federal administrative details change, as they did during the pandemic, we can't expect people to know without the coordinated outreach effort. Having an ongoing commitment to coordinated outreach is smart, responsible, and efficient. And for these reasons, we strongly urge you to find this proposed SNAP assistance program ought to pass. Thank you very much.
Thank you. Seeing no questions. All right. And we'll go right to Representative Edwards. Good morning.
Thank you, Mr. Chair. I'm Representative Jess Edwards, representing Auburn, Chester, and Sandown. I'm the chair of Division 3 Finance in the House. And this issue came up fairly late in our legislative process last year, where it was really too late to take any action on it. I was one of the people, many people I'm sure, that encouraged that this bill be filed. To me, this is a no-brainer. All this does is it has the department set up a document, a plan, and then that enables our charitable organizations to go seek funds underneath the plan. So this is this is just empowering our citizens in a local control kind of way. And so I would ask you to support it.
Questions of Representative Edwards?
Thank you for your support. I appreciate it.
So I just have one. We had testimony earlier that the department is moving forward with this. Notwithstanding that, would you agree with me that given the fact that this program has lapsed for several years, that it has benefits, that it partners with a not-for-profit field, that even though the department is going forward with it, we should pass this legislation? Would you agree with that?
Thank you for the question, Mr. Chairman. I'm one of the people that think that the fewer laws, the better. So I would be predisposed to not passing a law if the activity is already taking place. But as you pointed out, there's been a lapse for a while, and it seems, again, like this is a no-brainer thing to do to empower our local communities. And so I think we probably ought to go ahead and legislate this.
Great, thank you. Any other questions? Seeing none, we'll let you get back to your work. Last speaker, Dawn McKinney.
Dawn McKinney, New Hampshire Legal Assistance. I'm actually happy to answer any remaining questions you have. I think everyone's done a great
I
job.
love it, somebody who's not reading their testimony. So, any questions? That was a hint, hint, hint.
Mr. Chair.
Senator Whitley.
Just on wanting to know your opinion about this use of state dollars and, you know, clarification from the amendment.
I completely agree that it was written clearly from the beginning, but I have no problem either with the amendment. I think it's very, very clear.
And I'm going to ask you the same question I asked Ms. Laponis. Use of this kind of outreach, which is individual in nature to folks that are eligible, is a really good way of reducing fraud and abuse of the SNAP program. Would you agree with that?
Absolutely. I think it is. I'm sure that in the process of assisting folks, it is reducing fraud and abuse. But I would also go further to say that we have incredibly low rates of fraud and abuse in our state. I just did a quick calculation since everyone kept referring to me addressing this, and it was 0.15%. So
that is really excellent because, as I recall, the fraud and abuse for the SNAP program across the country is well above 10%. And so that's really exceptional.
That was the data I could find from 2017 real quickly from the state of New Hampshire's Special Investigations Unit.
Yeah. Okay. Well, helping people comply is always a good thing.
Yep.
Any other questions? Okie doke.
Thank you.
John, do you want to come back up here and talk about what you handed me, and if everybody on the committee has Senator Whitley's Amendment 296, John wrote the following at the end of the last sentence, or I'm sorry, on line 9, after the word administration, a new sentence that says, nothing in this paragraph shall be construed to prevent the department's use of available general fund appropriations for the purpose of this paragraph. And I propose to John the following, that we, at the end of the sentence, say if there are insufficient federal or private funds. And I think that's important to provide the push for those private funds. You good with that? You're smiling and nodding your head.
The department is good with that additional language. Thank you.
Senator Gray.
My problem with this bill is that we're reaching into the department and saying, above all else, you shall. Okay? I serve on Health and Human Services Oversight. Isn't this the kind of thing that Health and Human Services oversight should be watching on a continuing basis and not putting in legislation? I know you won't comment on the last part, but.
And Senator Bradley, in response to the question, I think that Director Hebert came to present the department's thoughts around this. I certainly look at the advocates back here. We're supportive of the program, but it is true that we do not require legislation to do this function.
Thank you.
Thank you.
Okay,
Could I ask a question?
yeah, John, Senator Sherman has a question.
John, just to clarify, in the absence of legislation, this program has lapsed for the last 5 years. Is that not correct?
I heard that testified earlier today, so I have no other information that would suggest otherwise.
And follow up? The evil eye. And during those 5 years, has not the Health and Human Services Oversight Committee been in existence?
It has been in existence statutorily since 1961.
Thank you.
61 years ago.
All right.
It was a great year.
It was.
I was there.
Now Senator Gray has a question.
No, I was going to make a statement that I would reserve my rebuttal to Senator Sherman's to the executive session because I think there's a lot more in there that we need to do.
And Senator Bradley, no further questions. Thank you very much.
All right. Seeing no one else that signed up to speak, I'm going to close the hearing on Senate Bill 404. I think this will take a little bit of discussion, so we'll move on to the next hearing, which is Senate Bill 416.
Clear the room on that one.
I get it. I'm not sure I want to vote against it. We'll see. All right. Where are we? 416.
We ready, Mr. Chair?
Nope.
Nope. Okay.
Now I am.
Okay.
All right.
Great.
We're going to open the hearing on Senate Bill 416 and recognize the sponsor, Senator Whitley.
Thank you, Mr. Chair. Good morning again, members of the committee. For the record, my name is Becky Whitley, and I'm honored to serve New Hampshire Senate District 15. So today, I'm honored to bring forth Senate Bill 416. This bill was brought after discussions with the New Hampshire Child Advocate, who you all know very well in this committee. So the bill requires children's behavioral health assessments to include evidence-based functional behavior analysis or assessment and a behavioral intervention plan prior to placement for children. So this committee is well aware that in 2019, you all passed historic reforms to the children's mental health system in Senate Bill 14. But several years later, we still have a significant amount of children who are receiving care out of their homes and, in fact, out of the state. These institutional placements can be lengthy and, of course, very expensive for the state. So I think doing an assessment to understand the cause and meaning behind a child's problem behavior can help us make more informed decisions about programming. These are children these are children with understandably difficult behaviors. They have high needs. But if we get a better idea about the source of their behavior, we could hopefully reduce the need for institutional placement. So this bill is a small step to ensure New Hampshire children get the appropriate care that they need close to home. So I'm going to defer more technical questions to the Office of Child Advocate, who is here. I will say that you have an amendment that was just passed out. I apologize it's so late. It's Amendment 0298, and my understanding that this amendment was drafted after discussions between the department and with the Office of Child Advocate, so she can describe that a little bit more. I think we went from requiring the assessment for all children to sort of refining who would get this assessment, making it more sort of targeted approach. So I would defer technical questions, but if there are questions from the committee, happy to field those also. Thank you.
Do we all have this amendment?
I just passed it out, or Cam just passed it out.
It's in front of me, but I couldn't see it. Okey-doke.
I will say too, under SB 14, if folks remember, there is now a standardized assessment that the department is using, and I think this additional sort of look at behavior builds on that. But it's important to recognize the department has really done a great job in the standardized assessment, and I think once it really is up and running, it's gonna do a lot, and I think this will help. Thank you.
Okay, thank you. So, who wants to speak next, the department or the child advocate? Ms. O'Neill, good morning.
For the record, I'm Moira O'Neill. I'm the child advocate for the state of New Hampshire. Thank you, Chairman Bradley, Vice Chair Gray, and members of the committee for hearing about the Senate Bill 416 from me this morning. I appreciate the opportunity to speak about it, answer questions, and comment on the adjustments in the proposed amendment. Senate Bill 416 addresses a need that's costly to both children and to the state. With few exceptions, New Hampshire's children are placed in residential facilities because they demonstrate problem behaviors. There are several underlying causes of problematic behavior. For example, there may be exposure to trauma, which results in children running away from abuse or neglect, or poor self-regulation, poor coping skills, impulsivity, and modeling of abusive offending behavior that's all associated with that trauma. There are disruptions in development, including from acquired brain injury, excuse me, that may manifest with disinhibition, distraction, and aggression. From language impairments, you'll often see associated with internalizing behaviors, such as self-harm behaviors, or externalizing behaviors, such as aggression and attention-related behavioral difficulties. And there are medical and intellectual disabilities, including genetic syndromes that may be associated with self-injurious behaviors. So that gives you a sense of some of the causes underlying for behavior that we're seeing in children. In some cases, children will appear to have no control over their behavior in a dysregulated moment. In other cases, children's behavior appears intentional, as they're very resourcefully learned to get their needs met through using and modeling problem behavior. In general, all behavior should be understood to be a form of communication. The challenge for us is to understand what is it that the child is attempting to communicate to us, or what is the function of their behavior, so that we can help develop better ways for them to send the messages that they're trying to send. So the office has observed a pattern of children being placed in residential programs without any firm understanding of the problem behavior. Without an understanding of the function of the behavior, effectiveness of treatment is going to be hit or miss. And some interventions, including the busy milieu of a congregate setting or a residential placement, may actually exacerbate the underlying problem. So Senate Bill 416 improves access for children to an analysis of the function of their behavior. A functional behavioral analysis, or an FBA, reflects early examination of behavioral psychology that demonstrated behavior is predictable response to some factors in an individual word. So in other words, behavior is prompted by a trigger, so a noise or a discomforting challenge. It's reinforced by consistency of response, like attention or avoidance, and it may be worsened by certain conditions, like a change in routine. The office has advocated for children to undergo an FBA prior to any placement. Information collected in an FBA will inform a behavioral plan that, when followed carefully with expert guidance, could even be successful at keeping the child home and not have to be placed in a very expensive residential placement. So without full understanding of the function of the behavior or what the child is communicating through it, there's not a full understanding of the type of behavior intervention required or the direction for adults who will be implementing a behavior program. So there's little logic in investing in expensive residential programs without the benefit of knowing what the child needs. As it happens, federal law actually dictates that schools conduct FBA under certain conditions. And we've proposed an amendment that you have before you that would require the department advocate with the school to honor their obligation to conduct the testing on children who are at risk of being placed in a residential program. If the school does not, the department may cause the FBA to occur. And if the child's qualified, seek reimbursement of the cost from the school. We understand this has been a difficult process for the department to recoup funds that they expend that schools should be paying for. But we still believe that it's really important that if children need these assessments, that they get them. For children who have been identified eligible for special ed, but who demonstrate disruptive behaviors that cause harm or to self or others, or may experience a pattern of physical restraints in response to behavior, we recommend the department initiate an FBA. So if they're not quite eligible or not deemed eligible by the school district, they still need that assessment. The Office of the Child Advocate has been promoting a better understanding of children's behaviors to effectively inform treatment for 4 years now. Where the child is concerned, if placed in the wrong program without the right behavioral support, the child's condition may actually exacerbate or get worse. The cost of residential programs ranging from $70,000 to $800,000 per year begs the question, why is New Hampshire sending children off to programs without knowing what the child needs and how they will improve, or whether the program even has the capacity to meet that individual child's needs? For a state that celebrates its leanness in budget, this is an undisciplined approach to spending limited funds that are targeted for children. We note that many of the children who are detained at the Sununu Youth Services Center encountered their first delinquency charges in poorly matched residential programs that did not have the full picture of the function of their behavior nor their capacity to help modify it. Landing at the Sununu Center is not likely to improve their access to an individualized positive behavior plan. So we've been working with a boy for over a year now who is a really good example of one who could benefit from a required FBA. Until the age of 13, he lived at home and had special education to accommodate a disability that includes autism. A series of events, including placement at a facility and isolation from his family because of COVID restrictions, exacerbated his behavior. He was trying to tell us something. He had long stays at an emergency department and at Hampstead Hospital. DCOF staff had an arduous time finding a new residential placement for him. His application packets described aggressive behaviors, but not the function of the behavior or measures to which he's most likely to positively respond. Although our office requested an FBA be conducted for many months, it was never arranged. Because his behavior was so poorly understood, other than that it was potentially dangerous, when a program was found for him in Mississippi, he was transported there at the cost of $24,000 for air transport. And still, despite that investment, his care in Mississippi is not guided by an evidence-based behavior plan designed from a careful analysis of his behavior. Why would we invest so much without knowing what he needs? To give you a sense of how other states approach the challenge of helping people with problem behavior, I've provided for you, with my written testimony, the state of Connecticut's Behavior Oversight Committee's recently distributed memo. It sets out expectations for the content of individual behavioral support plans that are clearly supported by information about the individual and analysis of the individual's targeted behavior examined with an evidence-based functional assessment. The state of Connecticut requires any intervention must clearly correspond to identified functions of behavior. So the state of Connecticut doesn't allow you to intervene unless you can prove that it's going to be something that's going to be helpful and there's a purpose to it. This is the standard that New Hampshire should be pursuing to best serve children. For these reasons, and to improve the care for children, I urge you to pass Senate Bill 416 in the best interest of children, and I'm happy to take questions. Thank you for your time.
Senator Avard.
Thank you, and thank you for your testimony. Just a couple, if I may. One, with regards to the schools being required to do these IEPs, how frequently do these children fall through the cracks? What are the numbers on that?
Oh, thank you for that question, Senator. I don't know that I have that number, but the fact that there are children who are in DCYF custody who have not had them suggests that it's not uncommon. We spoke earlier this week on the issue around establishing an advocate around special education. It's really common that in municipal discussions about budgets, special education is always a contentious issue. It's very expensive. It's an unfunded federal mandate. If you really think about what you can learn from following the law and doing these functional behavioral analyses, you're going to save a lot of money in the end because you can teach a child very early on how to manage behaviors and communicate more pro-socially.
With regards to that, so in essence, this bill will actually encourage the schools to actually do these IEPs. Otherwise, they could be on the hook for, the school districts be on the hook for a pretty large amount. It seems to be in the language on this.
Thank you for that question. I'm not so sure. I think the schools are already on the hook. The schools are already required to pay for it, to identify need and to conduct the FBA and to pay for it. So what this is saying is that that the department, and because I think what we're finding amongst field staff and supervision in DCYF is that people are not fully aware of special ed law, so they don't know to advocate for it. So this might hopefully, with some education around this requirement, it will get people to talk to school districts a little bit more to hold them accountable. But it also allows the department to move forward to make sure the child's needs are met while the adults are working out who's going to be responsible for it.
Thank you.
Senator Whitley.
Thank you, Mr. Chair. Thank you for your testimony and, of course, your advocacy for children. We are very lucky as a state to have you. So I'm wondering if you could just briefly take the committee through the amendment. I don't know if you have that in front of you.
I'm sorry,
I can give it to you.
All right, so before you start on that, is this a amendment supported by both yourself and the department?
Thank you for that question. So we've met with the department twice and had discussions about this, and we were asked to craft this recently, and so we tried to include everything that came out of our conversations with the department. In particular, we gave more time, and we tried to address any issues around a fiscal note by holding the schools responsible because they're already responsible. I think that the department, and I obviously can't testify for them, but I think the worries that we heard from them are worries that we have for all children's services, that there are workforce issues. And so there are delays. It's hard to meet time standards, and it's hard to get things done because there is necessarily no workforce. And we also think that there's an issue around reimbursement for behavioral psychologists who don't feel that they're paid enough for doing the work that they do. But we, as the Office of the Child Advocate, we can't advocate or advise you to aim for substandard policy around children's needs, especially when you consider the cost that can be incurred in the long run for these kids.
Okay, go ahead then.
Okay, so in terms of the changes that we made, I would say significantly, what we changed most was bringing in and articulating the responsibility of the school systems. And that is the changes that, let's see, under the new paragraph, starting on page 2. We did, although, excuse me, on page 1, we did notice number 5 at line 19, we did articulate the federal law that requires schools be responsible for functional behavioral analysis as setting up for this, this change that we put into the amendment. If the child's school district on line 3 has not or will not complete a functional behavioral analysis, the department shall cause one to be conducted. If a functional behavioral analysis cannot be completed prior to placement decision, this is the next change, the department shall ensure that it's initiated within 30 days. The original bill wrote that it would be completed in, I think, 10 days. And we understand the time lag, not just in workforce issues and getting someone to do this assessment, but also that they actually take a while to do. So, so as long as it's being initiated, there's some good faith there that it's going to happen within 30 days. And we still really hope that we can push back at ultimately to do these before they're placed so that we're not making a mistake. In the case of a child being out of a natural environment, precluding a comprehensive functional behavioral analysis, which is the standard and the best way to do these examinations, a functional behavioral assessment may suffice. So the difference between those two. When you want to analyze a child's behavior, you want to see the child in their natural environment because we all have our habits and our ways of communicating in our own homes. So you can't do that as completely, which includes a lot of observation of a child, like very tedious observation. The functional behavioral assessment is actually more of a record review and interview process. And so we're saying that you can, rather than do the very best analysis that you can do the next best thing, which is the behavioral assessment. And that would be in the case of a child who has been placed in a residential program, for example, and isn't in their natural environment. We also included in here that the functional behavioral analysis must be conducted by a qualified expert at a fair reimbursement rate according to regional standards. And if the school district does not comply with federal law, the department may seek reimbursement of costs from the district.
So, yeah, Senator Sherman.
Thank you, Mr. Chair, and thank you for taking my question. Thank you for coming today. Just looking through the Connecticut work that's done down there and the standard of practice, what would be optimal. This allows for a child, does this allow for a child to, actually it's twofold. Does this allow for a child to be placed, for example, in Mississippi before having the behavioral assessment? And I think to answer the first one, maybe you could just describe what would happen. This child that you gave the example of is having behavior problems, and I've had constituents where the child in the home has been a potential threat to the other children in the home. The child is removed from the home or sits in the emergency room. How does all this work chronologically? And you know, for example, saving the $24,000 transport to Mississippi, can this be done in a timely fashion under this statute so that that can be avoided and the assessment can be done as early as possible in this child's home? Do you understand?
I do, Senator. Thank you for the question. The answer is it's complicated. These are really complex family dimensions. They're complex conditions, and there's complex workforce issues here and having access immediately to folks. Connecticut has built up its developmental disability services and behavioral health services for decades. So they're able to really put standards around making sure that if the state is involved, the state is going to operate at a high standard. New Hampshire is just building that now. And certainly, for children as well, because children don't really benefit from developmental disability services until they're 21 here in New Hampshire, largely. So it really is a building process. So in the case of a child, obviously, who is a danger to others in the house, there has to be immediate action, and that's actually, a child protective issue to make sure that the child is someplace safe. But it's also understanding that the child is not a bad child. The child has an unmet need. And so really trying to spend some time understanding that need so we can resolve it quickly. So unfortunately, this amendment does allow for the child still to go to Mississippi, but it's with very, very clear understanding that the assessment process is happening however it can. In the case of a child in Mississippi, it's proven to be very difficult to hold the school or DCYF accountable because Mississippi doesn't have the resources. That's not a state that even certifies people who provide applied behavioral analysis. It's just not a good place to be when you have a complex condition. So there is that wayward. I do have to say that overlaying all of this, the Federal Family First Prevention Services Act that was sort of in our implementation of that office, we created this new contracting system with residential programs, which we never had before. It does set out expectations that children will be, if they are placed in a residential program, it will be for a reason, it will be for an appropriate evidence-based program, and the child will be periodically reassessed to see if the child is making progress. So it sort of all fits because we may still be placing children in places where they don't need to be, but we have to reassess them and move them out if it's not working. And so that would be part of this process, would be making sure that we've committed to making sure this child's behavior is analyzed and understood, that the facility where he or she is can accommodate the needs, and that they move rapidly back home. I will say I did have an experience when I was doing this work in Connecticut about 20 years ago when a mother called our office and complained that their equivalent of DCYF wouldn't remove a child from home because he was very dangerous, his behavior was dangerous, and he was threatening the safety of an infant in the home. Instead of advocating for him to go to a residential program, we advocated for a behavioral psychologist to come in and work with the family. He was in a day program. He worked very carefully with a very tedious behavior program. And the mother later called, not really long later, maybe 2 months, and said she couldn't believe that she ever made that request, that she didn't recognize her child because he had made such improvements because now he was able to communicate in a safe way what his needs were. So you really can, there's a lot of power in behavioral psychology and working with good positive behavioral plans, both in children with these extreme disabilities and in juvenile justice issues where kids are delinquent. And so it's really an important thing for New Hampshire to embrace. And I believe it will save New Hampshire a lot of money over the long run.
Okay.
Thank you very much.
Yep, thank you. Ms. Ross.
Morning. Thank you, Mr. Chair, members of the committee, for the opportunity to provide some information on this bill. While we did see the amendment last night, we're not taking a specific position on either the bill or the amendment. We'd like the committee to understand that we appreciate the importance of functional behavior assessments and their use when appropriate. The bill, as initially drafted, is overly broad in that it requires the functional behavioral assessment when it's not clinically indicated for all children in DCYF care who are potentially going into residential. We don't think that is a good use of time, resources, or money for those children where it's not clinically indicated. On the other side, it's under-inclusive in that it only applies to children and youth in DCYF's system. We have spent the last few years on the system of care trying hard to make a system that it doesn't matter which door you come in and you don't need to be engaged in DCYF care in order to get the appropriate services and level of care. So where this bill does not include children who may need residential care that are not in DCYF custody, we believe any solution should include all children who may need residential, not just children who are involved with DCYF. And we heard that this is historically something that is used in the context of special education and is required under special education law. To the extent we're looking for a solution to ensure that every child who is entitled to and it's clinically indicated has one, we believe the solution may best lie where it already sits with the educational system. The children that DCYF and Children's Behavioral Health are seeing that don't have them are historically children involved in special education or children who should be involved in special education. So starting at the source of the problem may be a better approach to the solution. With regard to DCYF becoming the debt collector for districts and causing something to occur, essentially that's a code for DCYF shall now bear the burden of the cost of these assessments if a school district doesn't do it, and then be responsible to go track it down. I can assure you we do not have any additional resources at the department to go track down payments from districts, which will mean the DCYF will just bear the burden of the cost. In the cases where we have had our CME try to get functional behavioral assessments for children through Children's Behavioral Health, there is a long delay due to the workforce shortage. While we completely agree that children are entitled to a service, they should get it, and we should do what we need to make sure that the services are available. The reality is it takes months to get them. They take hours and hours at $200 to $400 an hour to perform. They are expensive services and in limited supply. So we would certainly recommend making sure that the bill is narrowly tailored to the kids who need it and funded by the responsible payer before trying to make DCYF everything to everyone or force kids further into the deep end of child protection services when what they really need are services and education. I'm happy to take any questions and continue to work on any amendments going forward, but we do have concerns about the implementation of this bill.
Thank you, Mr. Chair, and thank you for your testimony. I kind of got lost because it's not practical for all the children, but yet it's also under-inclusive, and I think you're pointing us in the direction of narrowly tailoring the services, but to who?
I apologize. So I think it's under-inclusive because it only applies to the DCYF population, but it's over-inclusive because it's all of the DCYF population that may need residential. It leaves out children who are served through the Children's Behavioral Health System that don't have involvement with child protection or juvenile justice, yet still need residential services.
Thank you.
They, too, deserve the functional behavioral assessment that other children who are served by DCYF would be receiving if this bill were to pass as written.
And one follow-up?
Yep.
And with regards to the debt collecting of DCYF, there's no means for, you don't have the ability to collect these debts from the school districts?
No, I mean, currently there would not be a system set up that we would send a bill to a school district for a service that we paid for. As the law is written now, DCYF should not be paying for services that are otherwise covered by special education. So the default is the DCYF is the last payer. If we were to send a bill to a district, I'm pretty sure it would get returned to sender and sent back to us without further provisions in the law on exactly how much that's going to happen, what they're responsible, and how they're going to reimburse us for that. But I think it would turn into a much more adversarial process with school districts, and not getting paid in DCYF would end up bearing the cost of that.
Thank you.
Senator Sherman.
Just for clarification, so I understand. What would be an example of a child where this would not be appropriate, but who needs residential?
I'm happy to get you more information on the clinical side of it. I'm certainly not the clinician and would not want to represent that I am. But when I reached out to our folks that are implementing Fast Forward and working with our CME and administering our contracts, they have said that it is not appropriate for every child. It depends on the behaviors that they're presenting. There are other reasons that children would need residential, and that through the CAP process that we really don't have the results of how that's working. That's where we should be identifying which children and youth would benefit from this and then moving forward, not just one size fits all.
Super quick follow-up. I get that there are children outside of DCYF who would really benefit from this. So I get that. It's just to be clear, it's the flip. It's the ones that you say would be included in this in DCYF who don't need it. So if you could get me that, that'd be great. Thanks.
Absolutely.
Mr. Chair?
Yes.
So on that, I appreciate that issue and the, the need to make sure the kids who need this assessment get it. So the kids that you just described, those are the ones, you know, within the purview of the CME, fast forward, 135F, the system of care. But even those kids that end up in residential treatment, it's not a placement through the state. It's usually, if a kid in that system ends up in residential treatment, it's usually by parents, right? So there's no involvement for the state in paying for that.
That's not correct.
Okay.
They may have insurance, they may have Medicaid,
Sure.
which pays, but we would pay for uninsured who don't have another opportunity to pay for it if it's not covered by their private insurance.
Okay.
That's how the system of care has been developed, that they would come through children's behavioral health,
Yep.
get the CAT assessment and get the appropriate placement and have that accessibility to the services regardless of the ability to pay.
Okay, follow up? So thanks for that clarification, but there's no, because I'm hearing this from school districts, there's no like statutory, because what I'm thinking is like, could we throw in a statutory reference? But there is no statutory like authority for DHHS to do that residential placement under 135F. Do you see what I'm getting at?
Right, it is not court ordered in the same way that
Yeah.
child protection or juvenile justice case is court ordered, but it is definitely care through the Bureau voluntarily by the parent and family.
Okay, last follow-up. Thanks, that's helpful. So, with this statute, so if we sort of amend it, so the reference I think that you're saying it's only DCYF kids is the 170G reference. If we said, you know, if we put in something there like at risk at residential treatment, something like that, would that address your concerns of it being under-inclusive?
I think by building it into the DCYF statute, it's still going to be applicable to individuals served by DCYF.
Okay. Great. Senator Hebert.
One really
One
quick
more.
one. So any suggestions as to who to recoup the money for DCYF, right? If you're not gonna be the tax collector, how do we work that out? Because that hasn't been resolved.
Right. I think for children who are entitled to it under special education, the solution lies within the special education system to ensure that they're getting them in the first instance through the school and hopefully never getting to the point where they need residential.
Okay. Very good. Thank you very much. Last speaker, Emma Savini, New Futures. Good morning.
I will be very brief, as much of my testimony has already been covered. But I'd just like to echo the child advocate's position. New Futures supports Senate Bill 416. We believe that including functional behavior analysis before children are placed in residential treatment would provide more tailored treatment, which would include things to fix the root of the problem, so to speak. This will reduce costs associated with residential treatment. It typically shortens the treatment that children receive and it moves them back into their communities faster if they have to undergo residential treatment at all. When they have finished residential treatment, it's easier for functional behavioral analysis tailored plans to be implemented in their communities afterwards, which again creates more effective treatment throughout the child's lifetime, again reducing costs for the state and for the child's family. I'm happy to take any questions.
Yes, Senator Whitley.
Thank you, Attorney Savini, and nice to see you. I was this person several years ago, and so it's really great to have you here and continue that work on building the system of care. So you might have heard the discussion about how this overlays over the system of care, and so is it your analysis that this would also help those children in the system of care?
I haven't done a sufficient analysis on children outside of DCYF custody and if it would actually help the system of care in that instance, but I do believe this builds out the system of care for those children who are under DCYF purview and are in residential care or at risk of becoming in residential care.
Okay, seeing no further questions,
Thank you.
I'm gonna close, well, before I close the hearing, I think the bill has a lot of merit, but I want the problems that have been identified, worked out between the child advocate and the department and Senator Whitley. Okay? You've got a few weeks to do it and then come back to us. Okay? We'll close the hearing. Senator Adrd, you're up.
Thank you, Mr. Chair. For the record, I'm Senator Kevin Adrd. I represent District 12 here in New Hampshire, and I'm here to present SB 414 FNA. It is a bill that the reason for the bill is because apparently we had passed this in 2020, and it passed fiscal as well unanimously, and yet somehow, because of COVID, it fell through the cracks. And so I'm reintroducing the bill. The bill basically changes the definition of Alzheimer's disease and related disorders to include people who are symptomatic of these diseases for the purposes of expanding the population of granted staters who would be eligible for Alzheimer's disease and related disorder programs, ADRD, Respite Grant. The ADRD program was written into New Hampshire statutes in 1989 and has provided for respite care services for individuals with diagnoses of Alzheimer's disease and other related disorders. These respite care services are funded by the general funds and administered by family caregivers, supports, and consumer-directed programs at the Department of Health and Human Services. And under current law, only individuals with Alzheimer's or other dementia diagnoses may access the grant. And there are many reasons why an individual may not seek to be given formal diagnosis quickly, which will be laid out before you today in other testimony. These respite grants can provide a small amount of relief to caregivers who are caring for loved ones who experience one of these conditions. Caring for loved ones with Alzheimer's or dementia is a full-time job and can be emotionally, economically exhausting, with many caregivers cutting back at work and leaving the workforce altogether to provide care for their loved ones and at home. Any assistance we can provide for the 57,000 caregivers in the granted state and helping loved ones with Alzheimer's or dementia to stay in their home as long as possible is a win-win for families and for the state and long-term care systems in New Hampshire. And for these reasons, I'm asking you to pass this. One item to note is that the appropriation in the bill is set at $1, and the department has indicated that the ARPA funds to cover the increase. In the 2020 legislation, the sum of appropriation to cover the additional population was only $100,000. And thank you. And I had to read that in case I left something out. So I know you don't like reading. This is
Senator Adrd.
It's a wonderful bipartisan bill, probably one of the most bipartisan bills that we have.
There you go.
So thank you very much.
None. Okay. Mackenzie Nicholson, Alzheimer's Association. Good morning.
Good morning, everyone. Thank you, Senator Bradley and members of the committee. My name is Mackenzie Nicholson, and I am the Public Policy Manager of the Alzheimer's Association Mass New Hampshire chapter. I am before you today to ask for your support for Senate Bill 414, an act relative to respite care services for persons caring for individuals with Alzheimer's disease and related disorders and making an appropriation therefore. As Senator Adrd mentioned, in New Hampshire there are an estimated 26,000 individuals living with Alzheimer's disease or dementia and an estimated 57,000 caregivers taking care of them. Caregivers of those living with dementia have incredibly difficult jobs and often assist their loved ones with one or more activities of daily living, which can be anything from bathing to dressing to eating, and as well as multiple instrumental activities of daily living, such as paying bills, helping them with transportation, and shopping. 83% of help provided to older adults in the United States comes from family caregivers, friends, or other unpaid caregivers, And in 2020 alone, caregivers in New Hampshire provided more than 82 million hours of unpaid care to those living with Alzheimer's and dementia in our state, valued at more than $1.4 billion. In order to provide this care for a loved one, many caregivers report needing to cut back hours, take a leave of absence for work, or even leave the workforce entirely. They also experience depleted income and finances due to paying for health care for their loved one or other services living with dementia. The lifetime cost of this care in 2020 was estimated at about $373,000. 70% of that lifetime cost is borne by those family caregivers in the forms of that unpaid caregiving, and also taking care of out-of-pocket expenses such as things like medication and food for that person. In addition to the economic burden placed on these caregivers, as the person with dementia symptoms worsen, caregivers can also experience increased emotional stress, depression, and newer exacerbated health problems. 74% of these caregivers to people with Alzheimer's or dementia reported that they were somewhat concerned to very concerned about maintaining their own health since becoming a caregiver. Evidence also suggests that the stress of providing care to someone with dementia can also increase their susceptibility to a multitude of diseases and health complications. All of this to say that caregiving can be, like the senator said, physically, emotionally, and financially exhausting. To help reduce the burden on these caregivers, New Hampshire has a respite grant which, when received, can assist acquiring alternative care for their loved one so that they can take a break while knowing that their loved one is safely cared for. However, current law states that in order to access this grant, you must be diagnosed with Alzheimer's or dementia, thus preventing those without that formal diagnosis from receiving the grant. There are many reasons why someone may not have a formal diagnosis, and just to give you an idea of a few of them, we've heard that some medical providers, for one reason or another, are hesitant to make a formal diagnosis, and there still exists a stigma around Alzheimer's and dementia, and whether there's difficulty from the caregiver or the person living with the disease in exploring that diagnosis, the medical provider chooses to not fully explore it and takes baby steps. In some areas, especially in a rural state like ours, transportation can be an issue, and even getting to those medical appointments can be incredibly difficult. And lastly, a definitive Alzheimer's or dementia diagnosis can be incredibly costly and time-consuming, many times taking a lot of cognitive tests, specialist visits, scans, and even a lumbar puncture to make that official diagnosis. We know that having access to respite is more beneficial when it's started as soon as possible, not necessarily when someone is in the later stages of dementia, as the caregiver may already be burnt out. If we can provide this respite early on, we have a better chance of helping that caregiver help to maintain their loved one in their home. But in order to do this, we need to change the definition of Alzheimer's disease and related disorders to include those who are symptomatic, which is what this bill seeks to do. I'll stop there, but I did want to say the fight against Alzheimer's and dementia is personal for me. Growing up, and even until a few short years ago, my mom was an outgoing, active, and happy woman. Now, 66, she is withdrawn. She can barely walk. She has trouble finding words, and even recalling something as what she had for lunch is difficult for her. I know in my heart that my mom likely is struggling with middle to late stage of dementia. I'm lucky that I live close enough to my family members to help with her care. In fact, approximately 1/4 of caregivers are in my situation, in the fact that we are not only taking care of our parents, but also our children, known as the sandwich generation. Because my dad is my mom's primary caregiver, I don't have a good insight as to what happens during her medical appointments, but either out of love, denial, or fear, he refuses to be aggressive with her doctors and explore what's going on with my mom. My dad is really in over his head with her care, something that he'll admit freely, and I worry about it a lot because I think what will happen if my dad needs to step away to take care of other family matters, or if he gets sick, my mom could potentially stop taking her medication or stop eating, which is something that has happened before. But unfortunately, my parents would not be able to access this respite grant if they were to seek it because my mom lacks that formal diagnosis. So my mom's story is not unique, and although I have this personal connection, I know I'm not alone. By 2025, the number of granted staters who are living with the disease is expected to increase to 32,000, and as our state continues to age, that number is only going to grow. Alzheimer's is an incurable, fatal disease, and it's incredibly heartbreaking to witness. I ask that you vote to pass on Senate Bill 414 so that we can better support those living with Alzheimer's and dementia and their caregivers. Thank you, and I'll take any questions from the committee.
Very good.
Thank you.
Thank you. And good luck with your parents.
Thank you.
Okay, John and Wendy from the department.
Senator Bradley and members of the committee, for the record, my name is John Williams. I am the Director of Legislative Affairs with the New Hampshire Department of Health and Human Services, and with me is the Director.
Hi, I'm Wendy Altman. I am the Bureau Chief at the Bureau of Elderly and Adult Services at DHHS.
And we are here in support of Senate Bill 414. We want to thank the bill's prime sponsor, Senator Adrd, and also co-sponsor, Senator Whitley. Senator Bradley, you probably recall you were actually a co-sponsor on a bill that was brought forward in the 2020 session. However, due to the pandemic, many of those bills ended up getting tabled. That was one of the bills. Essentially, it's the exact same language with the exception of just one word on line 6, line 3, page 1, which is the additional word of which that you'll see in here. You'll see also identified at the back of it that the Legislative Budget Assistance Office, due to a lack of time and constraints on their part in late December, were not able to do a fiscal note worksheet attached with the bill. It is one of those great moments that we're actually able to tell you that with the Director Altman here, that we have secured what we believe sufficient funding under ARPA to be able to do this. So we are here in support not only of the policy, because the policy is very good and wonderful to address the issues upon an earlier stages than the onset of the actual Alzheimer's or related disorders. So with that, I would just turn it over to any questions from the committee or ask Director Altman if she had anything she'd like to add.
No, I'm just here to be able to articulate any questions and provide clarification.
All right, so John, I'll jump right in here. On the appropriation, it's obviously $1. There's going to be a higher cost. What do we think it will be?
Currently, we estimate that there could be an additional cost of about $117,000 per fiscal year. At this time, we don't have utilization numbers for state fiscal year 22, but we served 227 caregivers through this respite grant, and we do anticipate that to grow. So should there be justification and a need demonstrated, we will be requesting additional appropriation in the next biennium.
So you just said the plan was to use ARPA funds.
Yes.
To fund this. Are you going to go to fiscal?
Yes, we currently have Older Americans Act Title IIIe ARPA funds that will be dedicated to looking at additional funding for respite grants and to look at the amount that is awarded for a respite grant and increasing that from $1,500 to $2,000 during that time.
So is it even necessary to have the appropriation language in this bill? Just change the definition? Just, in other words, drop section 2?
I would agree at this time, yes. And the ARPA funds go through September 30th of 2023, so we would be able to utilize that.
That gets us into the next budget.
Correct.
Senator Guide is listening intently as a member of fiscal.
And as this was our practice for the Senate funds, assuming this committee does vote this out. Thank you.
All right. Okay, is there anybody else who wishes to speak? All right, I'm going to close the hearing on 414. Senator Guida, are you willing to wait another couple of minutes? All right, Senator Adrd. All right, Senator Gray seconds. All in favor say aye.
Aye.
Senator Adrd. Committee amendment to strike section 2.
And I'll second that.
well, that happened. All right, so Senator Avard has moved a committee amendment striking section 2. The effective date section will become section 2.
Move on to pass.
All in favor of that amendment, say aye.
Aye.
Any opposed? Senator Avard,
Move on to pass.
as amended, seconded by Senator Gray. All in favor, say aye. Aye.
Move on
Any
to
opposed? Senator Avard moves consent. All in favor, say aye.
Aye.
Any
Did anybody
opposed?
second?
Sherman seconded. All right. Senator
Aye.
Avard, you get the honors of taking it out, but you gotta have your blurb in today.
Do my blurb. All right. Thank you. Thank you, committee.
All right, we'll come out of executive session and we'll open the hearing on the next bill, Senate Bill 439, and we'll recognize Senator Guido.
Thank you, Mr. Chair, members of the committee. For the record, Bob Guida, Senate District 2, and prime sponsor of Senate Bill 439. It's no secret to you that brain injury has become something that is intimate and personal for me in the relationship with my family, with my wife. This bill is the result of my being appointed to the Brain and Spinal Cord Injury Advisory Council. We met several times, and this bill basically revamps the structure of that council. It has been met with and discussed and approved by all the stakeholders. The council itself was very unwieldy. Too many members, too many individual stakeholder group members, and it made finding a quorum difficult, also made moving things forward, therefore, difficult. So what this does is streamline that advisory council and change some of the legislation. I would also invite members of the committee to review Amendment 0290S. I'm not sure if you've had that distributed. You have, okay. That would only change Section 5 of the original bill. And that was just discussed and worked on over the last week with all the stakeholders. Again, what this does is to streamline, make more agile and effective, remove unnecessary language and affiliations for the council and for the activities with which it's engaged. I'll take any questions.
Any questions of Senator Guida? Seeing none. I think you're good to go, Bob.
Thank you.
Let's see, I'd recognize Melissa from the department. Namath?
And Senator Bradley, thank you. If we could just retrieve the copy of the amendment, certainly the department is very supportive of Senator Guida. And we just needed to have the language in front of us. So thank you, Melissa, if you'd like to.
Good morning, Mr. Chairman and members of the committee. And much like Ms. Ross a few minutes ago, the department is not here to take a position on this bill, but is simply here to provide information should that be necessary. The department had one bit of a concern with the bill as previously drafted, but it has been addressed in the current iteration of the amendment that you have before you. So with that, I'd just be happy to take any questions.
I think you're off the hook.
All right.
Thank you very much. The last person signed up to speak is Mr. Wade. Good morning, sir.
Oops, I guess I have to turn this on. My name is Steve Wade. I'm Executive Director of the Brain Injury Association of New Hampshire. And I'm here on behalf of our member families and caregivers in support of this bill. And just a little bit of background on the council. Over the last number of years, its main role is to hold essentially listening sessions throughout the state and assess some of the unmet needs of people living with brain and spinal cord injuries and stroke. It's done a lot of good work. One of the things I handed out is one of the more recent reports that talks a little bit about some of those unmet needs. The other thing I just wanted to mention is over the last couple of years, there's been some efforts. Well, I should back up. Most states have councils like this, and the councils essentially have a work group at the national level, and they come up with best practice as to how the councils work. And these changes actually bring our council into those best practice. And why that's important is the Federal Administration for Community Living does provide grants to states who have councils. And this will, I think, really help us in terms of our efforts to get grants in the future. So happy to answer any questions. Actually, I was actually asked by the chair of the council, James Piet, to actually read his letter of support and his testimony, if that's okay.
You can if you want to, but I don't think it's necessary.
Okay, perfect. I won't then.
Thank you.
It's short and brief, I know. So I'm happy to answer any questions, and thank you very much.
We
Great.
have it. Yep. Thank you.
Thank you.
Any questions? Okey doke. Seeing none. Close the hearing.
Move into exec.
On Senate Bill 439, Senator Adrd moves exec, seconded by Senator Sherman. Is there a motion on Senate Bill 439?
Move ought to pass.
On the amendment, yes. And it is Amendment 290S. Moved and seconded. Any discussion? Now you see, sir, why I didn't need you to read the letter. All in favor, say aye.
Aye.
Aye. Any opposed? Senator Sherman moves ought to pass as amended. Seconded by Senator Adrd. Further discussion? Seeing none, all in favor?
Aye.
Aye. Any opposed? Subsequent motion?
Consent?
Consent? Yep. Any discussion? All in favor?
Aye.
Aye.
Aye. All right, Senator Sherman, you get the honors. Blurb has to be in today. All right, somebody else want to do the honors?
No, I'm fine.
All right.
I can do it. Bob's still here. We'll get it done.
Cam can write it for you, but it's got to be, you've got to approve it today.
Cam, you can
Please
write
don't
mine,
leave before I get it to you.
Yes, sir.
Well, you're going to approve it electronically. No, we're not coming out of exec. I think there are a couple of other bills that we can do. Let's discuss them while we're here. All right. All right. So let's start with 416. This is the first one in my folder coming out. That's the one that we just had about the behavioral assessment. I think what I would ask is Ms. O'Neill, Ms. Ross, and Senator Whitley to work together and come up with an amendment.
Yeah, we already have a meeting on the books.
Okay, perfect. We'll move right along. All right. The next one we can take up is 404. We heard that this morning. The nutritional assessment program. I think Senator Gray probably had some things to say about that.
Outreach program.
Yep. Yeah. I'm on assessments.
The problem I have with this kind of bill is it starts to blur legislative action and executive action. Is that the legislature already passed a budget, said go do good things with that, and now, in addition to the oversight committee, we're reaching in and we're saying, oh, by the way, this one thing I want you to do this way. Okay? There are many priorities, in the department that they need to balance. And that we have a mechanism right now for overseeing what the department does, and that is the committee that I've been appointed to this year. And that through the actions of that committee or other action, the department recognized that it may be advantageous to go have this outreach program and took action to go do it. So why are we here worrying about legislation that says go do it when we're not the executive branch, we're the legislative branch?
Senator Whitley, do you want to respond?
Yeah, no, I appreciate those concerns, and, legislating with discretion and making sure that we're narrowly tailored. I do think that sometimes it's really important, and our Constitution contemplates the interaction between the three branches of government. And so, although there was an oversight commission, the recommendation wasn't made. And the reality is we've been 5 years without a plan. That means we've been 5 years with a significant amount of children, 17,000 children who are potentially eligible who haven't gotten that. And so, I truly understand the very many competing demands of HHS. But here's the thing. I think, it's great that they're doing it, but tomorrow we could have a new commissioner. Tomorrow we could have a new head of SNAP, and they wouldn't have that legislative authority to do this, nor a legislative mandate to do it. So I think it's a belts and suspenders approach that is narrowly tailored and that it is necessary. I don't always think a belts and suspenders approach is necessary, but because of the importance of this issue, because we're talking about children who are hungry, and we certainly have those children in every community, including my own, I think it's necessary to have that approach here and send a strong message from the legislature that this is an issue that we care deeply about, and that, I think it's furthermore that the federal government actually, really strongly encourages this type of plan, and I think, approval from the federal government with legislative authority, I think is a strong message.
Senator Gray.
I think it's disingenuous to say we don't have an outreach program. We may not have had a formal outreach program administered by HHS, but I'll look at the community of Rochester. I'm city councilman in Rochester. I know a lot of things that are going on in Rochester. And in Rochester, somebody goes to, go ask for welfare benefits. They are counseled in all kinds of things. If somebody goes to the food bank, they are counseled in a lot of things. There are outreach happening. Is there a formal outreach? Well, no. But as soon as that was brought up and the department recognized that it was something that they thought should go forward, we did it. Okay? Saying there isn't and all these children are going to go hungry, we've got a program in the high school that has a food pantry in there for the kids. In addition to the food pantries that are going on through the other social organizations in Rochester. I mean, there is a lot of things going on out there, and to discount them and say the children are going hungry, it makes me a little bit upset.
With all due respect, I'm not discounting that, but we had very clear analysis from the Fiscal Policy Institute that's saying that those existing programs, Senator, are not working, and that there's very clear data that 17,000 children in 2019 were eligible for benefits and not getting it. So with all due respect, the existing programs aren't working.
Okay, Senator Avard and
Yeah.
then Senator Sherman.
Just want a clarification, this still is revenue neutral, correct? Thank you.
Senator Sherman.
We have several examples in the legislature where we have directed departments and really sort of underscored how important something is for the department to accomplish and said, this is something we expect to get done. There's many examples of that. One of them is the 10-year mental health plan, which, by the way, sat from 2008 to 2018, and nothing was done, even though there was a 10-year mental health plan that was developed by the department in conjunction with the legislature. And so when the new one came in, the legislature said, no, this is going to get done, and if it's not getting done, you have to report why and how you're going to remediate. What we've heard here, and really with a lot of bipartisan support in both houses, is this is a priority of the legislature, not only because of the impact on the children, which Senator Whitley has said, but also because there's a huge fiscal benefit to the state, and there's a huge benefit to the way this would support our charities, and I think that's why Representative Edwards came forward. I don't think this is a threat to the system that Senator Gray has outlined. It certainly is augmenting and supporting the system that exists in Rochester and on the seacoast. So I don't see this as any kind of negative in any way. So I would fully support this.
Senator Gray. I support a lot of these programs. We voted on 403. I voted for that. In the city council, I vote for the CDBG grants. You know, I support the program. What I don't support is reaching into Health and Human Services on this bill and other things when we've got an oversight committee, which is the legislative's, created to look at things like this. That's the part, it's not the services, not the people, not the, fine. I'll give them the money like I did, in 403. But if we're going to have oversight, it should be through the committee. If we're not going to have an oversight committee, then maybe could be an argument said that we need to reach in by this bill and that bill and the other bill. But there are competing requirements. We are, through this legislation, elevating this one above everything else. Okay? Above DCYF's problems, above everything else that's going on in Health and Human Services. And that's why when we take the vote on this, that I will be voting no.
Okay, so let me ask you a couple of questions. I think we've heard good arguments on both sides. We've heard that the department is moving forward with exactly this plan, has the funding available to do it. Senator Whitley, what would you think about an ought-to-pass motion, and then when it got to the floor, the bill be tabled so that through that process, we could provide the oversight that Senator Gray is talking about?
No, I don't think I can support that. To me, we're talking about kids that need nutritional assistance. With all due respect, the department could have done this, and they haven't done this. No one has seen a draft of the outreach plan. It's like this amorphous thing. I absolutely think this is necessary, and there's no way I could go back to my constituents and say I didn't do everything possible to make sure our families have what they need to eat.
Senator Sherman.
I would just point out, I believe this has an FN, so if we do an ought to pass, it will move on to a second committee. And so while it will stay in play, the opportunity to have a second look at it, and then it will also go over to the House where Representative Edwards, who supports it at this point, could think about other options that you've brought up. But I think to stop it at this point is premature. So I would not support a tabling motion.
All right, well, there's no motion on the floor at this point. I'm just posing the question. All right, somebody want to make a motion? All right, so I think Senator Whitley has two amendments.
Yep. So starting with Amendment 0252, this is just the clarification of the deadline as requested by DHHS.
Okay. Seconded. Any further discussion on Amendment 0252? All in favor say aye.
Aye.
Any opposed? All right, that one's unanimous. Senator Whitley, Amendment
The next amendment,
296.
yep, is 0296. I move ought to pass with the language that Senator Bradley has in his hand that he's gonna read for Cam.
All right, so, and I'll give this to Cam. At the end of the first sentence on line 9, after the word administration, would come the following new sentence. Part of it I'm going to give to Cam, part of it I'm going to have to write. Nothing in this paragraph shall be construed to prevent the department's use of available general fund appropriations for the purpose of this paragraph if there are insufficient federal or private funds available. Did you get that last? If there are insufficient federal or private funds available.
So we're inserting after the word administration a new sentence saying nothing in this paragraph shall be construed to prevent the Department of Health and Human Services use
of available general fund appropriations for the purposes of this paragraph. If there are insufficient federal or private funds available.
I got it.
There's the, all right, discussion on that.
I think that covers the bases, addresses DHHS's concern, gives them the flexibility, and gives us flexibility going forward.
Okay. All in favor?
Senator
Avard, I'm
Yeah,
sorry.
that's, I just want, is it possible that they can weigh in on this a little bit, seeing how they're here?
Well, I think I'm going to let John weigh in again when we get to ought to pass with amendment.
Okay, yeah, because I have a question then.
So all in favor of this amendment, say aye.
Aye.
And opposed, none. Okay. Now, Senator Whitley moves,
Ought to pass as amended.
seconded by Senator Sherman. John, Senator Avard has a question.
And thank you for taking my question. Just in the spirit of what Senator Gray is talking about, is will this get more heightened attention than other bills? Will it take more of a priority than other programs that are going on and dwarf them? If I'm asking correctly, and why haven't we done this in the past?
So Senator Bradley, I do not have an explanation as to the past, but because you heard the testimony from Director Hebert that we're already engaging and moving forward with this initiative, Associate Commissioner Chris Santinello has also been very proactive and in fact provided a letter to the Division 3 on the bill that Representative Edwards came to talk about, where we put in writing the fact that we would be moving forward with submission in August for this particular outreach program. I do think that Ms. Hebert spoke very clearly. The department did have concerns about mandating something that we're already in the process of doing. So for me to say where this falls in the priorities, for us already to be engaged in this, I would say obviously we've met whatever level of priority that this particular issue needed to be addressed. So I don't think it would interfere necessarily with any other activities that are core to our mission with the department.
Just a quick follow-up.
Senator Avard, yep.
So is this just another layer of government, or is this just helping out in enabling for you to do your job more efficiently?
I appreciate the question, but I think I have to respect that the legislative branch does direct policy for executive branch agency, and I think we have to be respectful of all the voices on this committee as to what your thoughts may be. You did already hear, registered by Director Hebert, that our preference is not to have this mandated through legislation, that we are engaging this, but we have to be respectful of that relationship between the two branches of government.
Senator Sherman.
Thank you, John. Having listened to all the benefits of the program, I am thrilled that the department is going ahead and doing this. But without this bill, is there any compelling reason the department needs to go ahead and do this tomorrow if they decide they don't want to? For whatever reason? In other words, right now, isn't it the purview of the department to decide whether or not they want to do this program, even though there's legislative oversight through the oversight committee? It really, right now, it's up to the department whether or not to do that. What this bill does is it says this is the priority of the legislature, or a priority of the legislature. It's budget neutral. It actually brings in money to the state. It supports our nonprofits to do the job that they want to do. It actually decreases fraud, and the legislature is just saying, go for it. We're behind you all the way, and keep doing it.
And Senator Bradley, I was following a question initially, so if that could be rephrased as a question.
I think the question I asked is the appropriate one. Is there anything in this bill that hinders your effort to move forward with doing what you're already doing?
With the
Other
amendment,
than the fact that you don't like being mandated.
yes, with the amendment that was put forth by the committee, which we greatly appreciate, around general funds, my review at this juncture would say the answer is there's nothing in the legislation that would prevent us from moving forward. I'd like to try to be somewhat responsive to Senator Sherman's question, because it was, I think it was one that had a lot of information in it, and very helpful information. At the end of the conversation, it is true that although it's speculative at this point, because we're already doing this, but arguably I'm not of the belief that there's anything specific that would mandate us to have to do this. But again, that's speculation because we're already doing it. But there's nothing that requires us under federal or state law to do this, to my knowledge.
Mr. Chair?
Senator Whitley.
Thank you for answering that. I mean, I wouldn't say that the outreach plan is not in place yet, correct?
That is my understanding.
Okay, so it's not happening yet. So, and I also appreciate your perspective that it is the legislature's duty to set policy. And isn't it the case that the legislature actually has, we have a statute on SNAP, correct?
There is a state statute
Correct.
that deals
Yeah.
with
So the
Supplemental
legislature has
Nutrition
already
Assistance
taken,
Program.
yeah, so the legislature has already taken action, you know, setting policy that SNAP is a priority for the state, correct?
Yes.
Thank you.
Okay.
One final-
Senator Avard, I'm sorry.
And it'll be my last one, I promise. In the original bill, line 4, I have reduced fraud. Does this augment your ability to address the issues of fraud? Does it help strengthen, or does it address satisfactorily your understanding? Because I wrote down fraud on line 4, page number, on the first page. Does it help you?
I would have to go back and find where there's a direct intersect, but like specifically with fraud prevention. But I would have to go back and get you an answer to that. I would like to say, however, in terms of a timing issue, that the department is making best efforts to proceeding with this, but under the federal grant, the grant submission is in August. So just because it's not happening now, there are certain deadlines that we have to adhere to, and all states would have to adhere to for being able to get that. So I just want to give that background as to if anyone's asking questions, why not now? Because it is set by those deadlines. Senator Bradley, thank you so much for your courtesy, and Senator Gray, thank you also for your leadership and your work on the Oversight Committee. Much appreciated.
Okay, we have a motion on the floor, ought to pass as amended. I think we've had a lot of discussion, so I will call the roll. All in favor, say aye.
Aye.
And Senator Gray is opposed. Okey-doke, I'm taking this one out. Yeah, right. Okey-doke. So next one that's in the not exec file is my bill from this morning on Medicaid reimbursement rates for hospitals. More in the future on that. Bill 450. I've gotten some feedback on this at Senator Sherman's bill, the Prescription Drug Affordability Board. I think there are folks that come under the rubric of this, Senator Sherman, that you should reach out to in terms of the membership, potential conflicts, and you will have an amendment on that before, so we're not going to proceed on that one. Senator Whitley, I am
So
trying to
what?
remember on Senate Bill 444.
Right, so on 444, I am working with the department to flesh out the necessary appropriation. That's the only thing we're waiting on.
All right, we will pass on that one.
While we have John here, I'd like to ask a question about 326.
Sure.
Bradley, thank you so much, and Senator Whitley.
Thanks, John. So I had emailed folks a couple days ago requesting, just in line with the department's testimony on 326 about, sort of further aligning it with the early, I don't know what it's called, the integration team, early childhood integration team. And Karen I was unclear from Karen's response about whether you folks were planning to suggest language or should I be drafting the amendment?
So, Senator Bradley, in addressing Senator Whitley point in time status, the department is engaged in ongoing conversation, as we had noted at the public hearing from the department. And if you refer to the wonderful committee report that's done by Mr. Lapine, you'll see the entire list of what the department's concerns. I do think that, Senator Whitley, you certainly were helpful in an amendment on just one section of the bill dealing with paragraph 2 in it. But there's still many unanswered questions that need to be addressed through appropriate legislation. So we're still here as a resource. I would just ask the committee if they would respectfully hold it to allow us an ongoing conversation with Senator Whitley. It is not ready to go or anywhere near ready to go, and it's comforting to know we have a March 17th deadline to see what could possibly be done. But it's a very complex bill to try to tackle. I just want to make expectations being gauged appropriately.
And I would just say, Senator Whitley, the feedback I'm getting is that this bill, while it has an awful lot of merit and a lot of work's been done on it, it should be introduced as part of the budget process. And I think we probably ought to have a conversation on that offline.
Sure, absolutely. And I understand a lot of folks are meeting with the governor on this as well.
Okey-doke. Let's see. All right, I'm going to skip over 419 because I'm having a hard time remembering.
Senator Prentice was going to be working with the Public Health Networks on the amendment, I believe.
Exactly. All right. All right, there is an amendment on Senator Rosenwald's bill, Senate Bill 319. So after the hearing, I approached some of the carriers about some of the issues that were raised about recovery of costs, eligibility of costs if you offer it to people that are vaccinated, this incentive. If you offer it to people that are unvaccinated, does it also have to go to people that are vaccinated? And there was concern about the expense of that. That's federal law. So Senator Rosenwald, kind of at my urging, came in with this amendment that I'm not really sure is necessary because insurers can already do this, offer wellness, financial incentives. I mean, they have a wellness incentive to take the flu shots. They have wellness incentives to go to the gym. So there are any number of these things that insurance companies can already do. But she brought this amendment forward, which I think, you know, Heidi, if you want to comment from the perspective of AHIP, doesn't raise the same issues that you raised after the hearing with myself. Okay. So, Senator Sherman.
I move pass on amendment 260S.
A second.
All right. Discussion. Senator Gray.
My notes have may and shall comments in here, and I don't see that addressed in here.
It's a replace all.
Is it?
I believe so.
Replaces section 1 and puts in A. There's no shall.
Right, so sections 2 and 3 stay the same. Section 2 is a repeal of this temporary program, and then the effective date is section 3. So it's not a replace all amendment, it replaces section 1, which on line 4 of section 1 says shall provide a wellness financial incentive to may provide a wellness financial incentive.
It also removes the line 6 and 7.
All of the recovery. So my understanding is there could be a per member per month fee that not a fee, but just a recovery of costs by the insurer for doing this on their own at their own incentive. Right? Did I get that correct? Okay. Senator Adrd? All right, very good. Senator Gray?
Just since I've had a chance to read this, all right. So we're putting in section 420-G:17, and then we're repealing it, and then the effective date for the repeal is the end of 23. So this is just a COVID thing, but are we really trying to say that COVID or other things, you know, I guess what I'm trying to say is that if they have the right to do incentives, okay, and they can pick the things that they're doing incentives for, then why did I need the bill in the first place? And if that's not the case, then why am I repealing, you know, the thing that we're putting in? You know.
Well, as I said before, I don't really have a problem with moving forward with this bill, but I agree with you, Senator Gray, it's not necessary because the carriers can already offer these kind of incentives. Senator Sherman.
We're just talking about the amendment right now.
Yep. Are you talking or not?
No, I just was bringing us back to the amendment vote.
Okay.
I'll support the amendment, but not the bill.
Somebody moved the amendment.
Yes.
All right. So let's vote on the amendment. All in favor of the amendment, say aye.
Aye.
Any opposed? Okay. Now, Senator Sherman.
I would just say I'm in favor of the bill. I think it clarifies and makes a strong argument for that recognizes the differential cost, just like flu shots and other wellness programs are associated with decreased cost to all of the subscribers to an insurance program. That's why they are put in place. We know from national data the cost of each person who is not vaccinated. We know from actuarial data and insurance data that it is much more expensive. So all this does is it recognizes that, just like it recognizes it when you're talking about flu vaccines or other wellness programs, that this is something that the insurance companies can use incentives, as Senator Gray has said, and others maybe this doesn't change anything, but it makes sure that the insurance companies know that the legislature recognizes their capacity to do this and basically would support moving forward with wellness programs that incent vaccination. It does not do anything, especially with the may in there, to force vaccines. It's not a vaccine mandate, and so to use this as a objection to vaccines is really not consistent with the science. So I would urge all of us to show the leadership that we need to show that people who are vaccinated are costing a lot less. They are dying at much lower rates. They are utilizing healthcare systems at much lower rates. And all of that is based on national and state-based data. And that's all this reflects, just like other wellness programs. So I would appreciate the support of the committee.
Anyone else? All right, the amendment's been adopted. Is there a motion about to pass as amended? Offered by Senator Sherman, seconded by Senator Whitley. Any further discussion? Seeing none, all in favor say aye.
Aye.
And opposed?
No.
Nay.
All right, so it's 3-2. Senator Sherman, you get the honors on this one.
Does this have to be done before we?
No, because this will be on the regular calendar. All right, we're gonna go to Senator Sherman's Bill 280, which you were gonna told me last week you were gonna move interim study.
Yeah, I'll make a motion for interim study.
All right, this is the bill that Senator Sherman introduced that allowed certain oversight boards to meet remotely.
Why?
Well, let me speak to my motion. You know, Senator Gray brought up that there's a bill that has been introduced to change the way we look at remote meetings and remote versus in person. It's introduced by Senator Daniels. It gets at the root of the issue across all the meetings. And Senator Gray, I don't want to speak for you, but I think that just was that these meetings would be much better served as in there are multiple bills in the House and the Senate looking at specific councils, commissions, and committees wanting to allow for more remote access. And the point is that I agree with Senator Gray that being able to move forward with addressing the issue of remote meetings in a more systematic way. Not only do I think that's what's more likely to pass, but also I'm willing to potentially bring this back as an amendment to a House bill if we don't see that movement, but I don't see this being successful in its current form. So rather than put a lot of time into it at this point, I would move interim study and await the outcome of Senator Daniels' bill.
Senator Sherman, your microphone was off for that entire.
Okay. The short version is, I
Senator
think
Sherman moves interim study.
that's the very short
Seconded
version.
by Senator Hebert. Is there any discussion, Senator Gray?
I might suggest to the senator that if he takes this out, that he offers a tabling motion, which would give him maximum ability to change midstream.
And I will note too that there's actually two bills in judiciary upon which I said there's Senator Daniels has a bill, and then Senator Perkins Coca also has a bill. Senator Daniels is more expansive. Senator Perkins Coca is a little more tailored. So there are two bills.
All right, Senator Sherman has moved interim study. All in favor of interim study, say aye.
Aye.
Any opposed? Now, if you want to have it tabled, let's not put it on the consent calendar, but given that there are two other bills, I don't think we need to put it on the table. But if you want to put it on the table, that's fine. James, you opened the door.
I will leave it off consent, following the wisdom
It's off
and
consent.
guidance of Senator Gray.
Okey-doke.
Is Senator Sherman going to take that out?
Senator Sherman's going to take that one out. Senate Bill 288, that's COVID vaccines. Still working on an amendment for that. I think the last one that we can hopefully take up is Senator Rishardi's bill on the pilot program for an association health plan. And I have an amendment that everybody should have, Amendment 250. It's Senate Bill 286.
I don't know if I got the amendment.
It's Amendment 250.
I don't think I have that. Did you testify on this bill?
Nope. Yes, you may.
Do you have a position on it?
Do we have the amendment?
I'm making copies of it right now. I just thought.
I do have a copy.
I have a copy.
All right, so the one issue that was raised in the public hearing was any pilot program and the intersection of state mandates. So I added line 5 and 6 in the amendment that says the pilot program shall include all state mandated health plan coverage and no state mandated health plan coverage shall be exempt. So that will include all state mandates.
I had to note that this was from the AHA.
You got to
Your microphone.
use your microphone.
I'll get trained, Jim. Was federal also included in that, or is that automatic? That
It's automatic. They are
Okay.
covered by the 10 essential benefits.
Okay.
We about to pass on the amendment?
Second.
All right. It's been moved, it's been seconded. All in favor, say aye.
Aye.
Any opposed? All right. Senator Abard moves.
About to pass as amended?
Any further discussion? All in favor, say aye.
Someone needs to second it.
Seconded by Senator Gray. All in favor, say aye.
Aye.
Any
Consent.
opposed?
Consent?
Senator Avard has moved consent. and
Second.
Senator Avard gets the honors of the blurb.
Wait, Cameron, you want to write that for me?
Do we need a vote?
Thank you.
We did. We voted on it.
We have to vote on the consent motion.
Oh, I
Yes.
guess we did.
Yes.
All in favor of consent,
Aye.
say aye. Aye. Okay, tomorrow we have hearings. I don't think any of the bills that we went through earlier that weren't ready to go will be ready to go tomorrow. So the only execing we'll do tomorrow will be on tomorrow's bills, unless something mysterious happens. Okay? Is there a motion to adjourn?
We have to move out of exec first, right? Move out of exec.
Adjourn out of exec.
All in favor?
County.
Aye.
Aye.
Now is there a motion to adjourn?
So moved.
We're adjourned. Thank you.
Good.